Hey everybody, this is Nicole Harris-Roberts with Vinyl, and I am joined here today with a wonderful panel about why mega healthcare is so challenging. And I'm joined today by Veronica Suh. She is the head of product at TruePill. We also have Tara King-Hughes, Senior Director of Product Management at Strava, and Alicia Pina, who is a Principal of Strategic Planning and Performance at Blue Shield of California. Welcome to you all. Thank you so much for being here. So Veronica, tell us your story. How did you get started in product management?
Thank you for having me, Nicole. I'm really happy to be here on this panel. I've been in product management for a good 15 years, previously in financial services, then did a few years in healthcare at Kaiser Permanente, stepped away from the financial services and healthcare, moved to insurance, and then recently joined TruePill back into the healthcare space, leading the product team for consumer health at TruePill, a Series C startup. And we provide digital platform capabilities for the healthcare industry to provide direct-to-consumer experiences for all the major players within the healthcare space.
Excellent. Tara, why don't you tell us how you got into the healthcare space? I understand your background is quite varied as well.
Yes, it is. I started my career off being an engineer and was pushed into the field of product because I had such a passion for quality user experiences. I spent the bulk of my career at a media company prior to coming to Strava. And it was during the pandemic where I wanted to align every part of my life with my passion. And my passion is health and fitness. And so the stars perfectly aligned and led me to Strava. And so I just recently started there in February. And so at Strava, we are redefining the athlete and stating that it's not a football player, basketball player, it's anyone who sweats. And we're motivating people to be the best at their own pace. And we're also creating new experiences to connect and motivate individuals to meet their fitness goals.
That's awesome. I can connect with that very well. Anybody can, right? It's so inclusive. I love that. Yeah. And then Alicia, tell us how your background is totally different, but yet here you are, a product person in healthcare. How did you get there?
Well, it's been a crazy ride, right? So thank you first for having me. I first started my career in nursing, and I thought that's where I wanted to go as a woman in a culture that, most of us were told you have to go into nursing. That's the place that you're going to get paid. And so that's where I went. I spent 10 years at Sutter Medical Center, and whether it be neuro or ICU or pediatrics, I did find that I was more of a problem solver, engineering type mindset. And so I took a leap, left healthcare, and found myself in high tech at Intel. At Intel, I was a project manager for graphics engineering. I found myself in the love of the problem solving, but there was still a disconnect for me. There was still a piece that was missing, and it was that healthcare. So aligning again, like Tara, my purpose and passion, took a big leap and went over into a not-for-profit that was founded by physicians, Blue Shield of California. Been there for the last 5 years in product strategy, working towards, making healthcare access for all, but also affordable. Something I'm very passionate about, especially when you look at areas where systemic issues are, where we don't have good access to care. How do we meet the member where they are? So I'm really happy to be where I'm at, and I'm looking forward to this panel.
So interesting too to hear that you have the frontline experience and bringing that into healthcare. I think that some people tend to find that being a product manager in healthcare, it's sort of a requirement that you need to care about healthcare. And I think it's natural for people to sort of gravitate toward that. People like you, people like Tara. But not everybody feels that way, right? I think Veronica and our prep call, we were talking a little bit about passion PMs and people who feel like, they gravitate toward healthcare for whatever reason. Can you talk a little bit about the folks that you've been working with or are seeing out there, people like us who are sort of, what are you seeing in terms of the mix? Are most people sort of passion PMs and really want to make a difference? Or are you also seeing people who are just like product is product is product, and healthcare is sort of just it just happens to be the industry that I work in?
Yeah, I think that's a great question. And it's actually a good mix of both. Definitely a lot of folks who maybe were planning to go to med school, or they come from a generation of pharmacists or doctors. And so they've always been attracted to the space, but for whatever reason didn't actually go directly into the medical field, or were transitioning from the medical field to the business side of things. But I think what is a commonality for everyone who works in healthcare, in products or otherwise, is everyone has experienced the challenges of healthcare in America. And so in product, you get to really try to solve those challenges in a lot of different ways, because the healthcare ecosystem is so complex in the US. It's been, brought up many times about the need to disrupt healthcare, to consumerize it, to make it more accessible, to make things more transparent. And it's been a really tough nut to crack. So I think whether you're coming here because you have a passion for healthcare in particular, or you love product management, like in my case, at the end of the day, you really want to solve those problems for those millions of patients out there that are experiencing those issues and those challenges.
Let's dig into that a little bit, the challenges. Why? So the premise that I'm about to pose is that doing product management in healthcare is different than in other industries, right? Why is it different? Tara, I want to start with you because you have an engineering background. You have not always worked in a health and wellness sort of space, but tell me what you're finding in terms of, well, I guess first question is it different in your opinion? And if so, why?
Yes, I think it's different because you have to be thoughtful when you're a product manager in this space, because you're actually have the possibility to impact someone's both mental and physical well-being. So you have to put that user, or in my case, the athlete or the patient first when you're building and thinking about features. I think other industries don't have to consider that as they're building products. But I think when you're in health and in healthcare, you do, because you have to put that patient, user, athlete first. And you have to think about it in every phase, every idea, every feature. When you're building a product, you have to build it around that person. And the goal is not to cause harm, it is to add value.
I think to add to that, consumerism is really different, right?
Yeah,
and in the big tech, high tech industry like Apple, you have people that will wait in lines to get the same product. But in healthcare, it's not a one size fits all. In Strava, you have multiple age bands, and your older group is going to feel like that athlete. And I will tell you that I recently used Strava on my Peloton, and I am trying to increase my score. So I love that. But it has to meet that person where they're at, where they need it, when they need it, and sometimes even before they need it, that they even know they need it. And so it's very complex because it's human, and you have to be courageous, and you have to be very vulnerable and think outside the box and all the different points that you may touch by making that one change.
Yeah, and I will say also with healthcare, there are so many legacy technologies and platforms that we're all working with, and that were not designed for direct-to-consumer experiences. And so as consumer expectations have changed, as they compare their Amazon shopping experience, or in Alicia's example, the Apple experience, there's a certain expectation of anything that a consumer is interacting with, whether it's healthcare, whether it's e-commerce. And it's been really challenging for healthcare to really hit that mark in terms of providing that experience that people expect, because of the legacy technology that was never designed to create true, really great end-to-end, great UX user experiences, as well as what Tara mentioned, all of the stakeholders and players in this space. It's a multi-sided marketplace, right? If I create a great digital experience in the healthcare space, I have to think about the clinical impacts, the provider impact. Is there a PBM impact? Is there an insurance impact? And so all of these things create a lot of complexity and nuance when you're trying to build solutions. And sometimes they actually, can handcuff you, even though it's the right patient experience for whatever reason, due to a HIPAA reason or a technology limitation, you're not able to deliver on that promise that you're trying to deliver.
Would you be comfortable sharing an example of that? An example of something where you and your team identified an opportunity and wanted to deploy that capability, but could not do it?
I will share a previous employer where I had that experience, where we had a fantastic vision of what a consumer digital experience should be for a patient. And it was approved by the board, it was funded, we had the resources lined up, and we ultimately couldn't do it because of the legacy EMR, EHR that we were using, which was not willing to build those services for us to enable those experiences, because that particular EMR was also producing an out-of-the-box software solution that their other clients were using. And so in their mind, there was no reason for them to prioritize that work, which completely makes sense from their standpoint. But because we were fully dependent on that particular vendor for giving us those APIs, again, so that we could have control of the user experience. We were very, very limited, and we were not able to, we had to actually cut down scope quite a bit in order to deliver even a piece of that value. And so that really kind of degraded the experience in a big way.
I think, Veronica, it goes back to what you were saying, right? It's the infrastructure. And in comparison to high tech, the infrastructure is built upon velocity, going faster, being able to accelerate your graphics on your processor. In healthcare, it's about how do I make sure the member gets it? How do I make sure the provider understands it? And so the technology hasn't always been at the forefront. I do feel like, though, we have this like soda bottle of like shaking up, right? And you feel that pressure, because it's a beautiful thing when you have these big tech companies coming in and adding pressure to maybe some of the archaic challenges and infrastructures. And so we're almost there. I feel like we're getting it. The pressure is there. We have some really good, healthy pressure coming into the market. It's going to be an interesting, next 5 to 10 years to see what happens. But the infrastructure, I'm with you. It wasn't built to be fast. It wasn't built to be technical, like robust. But I think there are a lot of people that know that now.
For sure.
Yeah, Nicole, actually, I will give you apologies, Tara. I wanted to just expand on the specific example that you asked for. At one point in my career, we were trying to build a dashboard experience where you could manage the health for yourself and your entire family in one view. Behind the scenes, what that means as a product manager or as a solutions engineer means calling a lot of different databases to return information to display on a page. And as Alicia mentioned, that infrastructure was not designed to do those things. So imagine hundreds of thousands or millions of users at a time trying to ping multiple databases and trying to render a single page could take 30 seconds to load. And what consumer, regardless of what industry, wants to wait 20 seconds for any page to load? And so those are the kind of things that we're having trade-off discussions about every day. But every time you trade off, performance, you're also trading off experience.
Yeah, and Veronica and Alicia, I would just add, the system is so out of date. I think, spending so many years being tied to physical brick and mortar environments, being so heavily dependent on paper has definitely limited the innovation in this space. But I so agree with you, Alicia. Disruption boom is definitely on the way. I think the pandemic has accelerated that tremendously. I think that there are new companies that are coming into this space and innovating in new ways. Both Google and Amazon have made significant acquisitions in this space. So it's now only a matter of time of when the disruption is going to happen. And so I hope in the industry they can start being more forward thinking in this space, because some of these new and upcoming companies that are startups are truly going to challenge the way they do business, challenge the paper, and challenge the brick and mortar.
I agree with you. That data piece, it's so interesting in a data world. You come in an engineering, like data is key. Like it's going to tell you how you're going to solve, what is the problem, where are the bugs, how are we going to validate. The data that we have at our hand, and Veronica, I believe you've already touched on this, is like that, having that data at the front end, right? If you can only imagine, I pick up my phone, I know what my doctor's prescribed to me. I know what not just that prescription, but what are the side effects? What is the symptoms of my diagnoses? And I just went to the store, and now I've added this multivitamin. It's holistic care can't just be surface any longer. Holistic care has to lift up the hood and think, if we can't provide a simple hearing aid for a patient, we have to look at the outcomes of that. Isolation, depression, those things come with other conditions that cost us healthcare money, but also cost that patient life, right? And so going back, it's when we design this product, you have to design with the person in mind. And it's not a one size fits all. It has to be all around. And it can't just be for those that can afford it. It has to be for all.
Tara, I want to ask you a specific question following up on what Alicia, you just said. Having solutions that are affordable for everyone. How do we think about that in a consumer product context? Let's Strava, for example. I'm somebody mentioned, I think Alicia, it was you who mentioned your Peloton. I'm a Peloton user as well. They've gotten a lot of flack, right, about having a solution that not everybody can afford. So how do you think about this in terms of, Tara, bringing that ideal to everyone as an athlete and then delivering products that people can afford and are accessible for them?
I think one thing that Strava has done very well is to provide both a free experience as well as a subscriber experience. So providing to both, so that if you could not afford the subscription, you can still have a very meaningful and valuable experience, still focused on your healthcare, still focused on you having the very best way, a system to help guide you through your fitness plan. Now, if you can't afford the subscription, which is something that we try to keep at a very marketable rate for both here in the States and as well as global, then of course you get additional features. But I think as a lot of companies are just focusing on building subscription, we're focused on athlete first. So ensuring both the free and the paid experience adds value, allows you to complete goals that you want to meet for both fitness across 32 sports. So not necessarily limiting you because you don't have the subscription, but maybe you don't necessarily get all the bells and whistles, but you still have a very meaningful freemium experience with the hopes for you to subscribe. But even if you're not a subscriber, we want you to stay active, and we put key touch points in the product for everyone to remind you to be active. Have you seen this new route today? Check out these maps, find new ways to connect and participate in challenges. And we do that by both valuing both the overall experience for all, as well as the subscription experience.
And I will add that at TruePill, I think our partnerships with our direct-to-consumer brands has really made healthcare more accessible. Because when you think about access, it's not just about the cost, but also about understanding how to navigate the really complex healthcare ecosystem. And that can be very, very difficult. Even as someone who's worked in healthcare now for over 3+ years, I can't say that I could give any sort of seminar about how the American healthcare system works. But I do know there's a lot of barriers there in understanding what your insurance covers, whether certain providers within network, whether a certain type of care is HSA, FSA eligible. And having these direct-to-consumer experiences actually allows users to make a choice to pay out of pocket, in cash if they want to. And providing kind of that transparency in price so that they can make that determination as to how to best fund their care. And so we provide, pharmacy fulfillment and delivery services by mail order. We have telehealth services that, as you guys mentioned, are now accelerated in terms of demand because of COVID and people feeling more comfortable doing video visits versus in person. And so those sort of cost efficiencies are passed along to the patient along the way.
I love that. The value-based care is so important, especially when you can pair that with something like a chronic condition and you want to remove the barriers and remove the cost of prescriptions. Because when you have someone that's like maybe on a Medi-Cal plan or a Medicare plan, where they may not be able to afford the cost of their prescriptions, but they're in a chronic condition, those are the things that I love working on, because it has a direct impact, and you have to remove that cost barrier again, because it's the medication maintenance, right? Is how do you get the medication to them quickly, and timely, and even if you can mail it to them, that's even better, right? And so I love the way that product healthcare is going, where now you can get your mail, get the prescription mailed to you. You have notifications sent to you when you're getting low on your prescription. Those things that we didn't have like 5 years ago, or even the email connection with your PCP. So the pandemic also has really helped us. And I hope that we'll be able to continue to accelerate that, since we've seen so much great things come from telemedicine and, the providers having that bandwidth, being able to see multiple patients instead of just always the traditional.
This is also bringing up the point that the consumers themselves are key advocates in their own health and wellness journeys. We always have been, right? But acknowledging that as product people, we have to consider the train has left the station long ago. 15 years ago, well, we were having conversations about how hard it was to adapt to what consumers were asking for, and sort of being, I think there was frustration and some trepidation on behalf of product teams to think about how are we going to, not just do we have to, I think that's an old conversation. How are we going to embrace these new motivations that people have to, I mean, why do I have my phone on my person 24/7? I mean, that was not a behavior that I had personally 15 years ago. At a certain point, it was 2000, it was probably 7 years ago, 8 years ago, where I left my phone in the car and I walked away and I thought, I panicked actually. I thought, oh my gosh, I don't have my phone. Why is that? Why do I feel compelled to wear this watch around all the time, right? It's like, I guess there's not really a question in here. I'm just thinking about what is the interplay between our desire to be an advocate and also the technology sort of bolting onto our experiences in such a way that now I depend on my watch and I'm dependent on my phone to keep track of how much I'm walking and, alerting me about everything, including when my prescription refill is ready.
I think the watch is so important. My daughter, who has epilepsy, it's important for me to get that notification when she has a seizure. And so we have the Internet of Things. We have all these things connected that improve the lives of people. I'll tell you, as a mother of an adult child who wants to live very independently out of my house, I need to know, I need that safety net. Right. I need that watch to call me and tell me that she's had a seizure, she is okay, and everything is good. And having that is, for me is good, but we also have this age band, this age population that's rolling in, and we need more connected devices. We need more things like Strava to make them feel like the athlete that they are so they can continue their healthy lifestyle. I'm really interested in what the Internet of Things has to bring from that connectivity.
I hope, and that's a very good point, Alicia. And I hope from that connectivity, it brings education. You talk about that band of ageism. And I think in that, we have to understand that there is a population of people who not necessarily be technical savvy, but they have to be to get the very best care, to interact with apps that can streamline some of the complexities in the health space. So education, I think, is something that should be for all. I think certain devices should be for all. I know that there's several like internet companies who offer free internet service or very low cost internet service to reach certain populations, and which is very valuable. But the same thing has to also happen in the mobile space, because to your point, Nicole, it has become the device. It has become just as essential as your wallet to have a mobile device. And I think it's something that we have to get into every home and to every hand through meaningful education.
Yeah, there's definitely something really interesting here as I listen to you all speak, in that, although, we're all coming from different backgrounds and working at different types of companies, but we're all trying to do the same thing aside from solving problems in healthcare, which is providing access to care in a very convenient manner, because ultimately that is preventative care. And I think we know from multiple studies that healthcare expenditure is the highest in the last 2-3 years of life. And if you were to invest those dollars into preventative care and wellness, which is exactly what Strava is doing, it sounds like you guys are trying to do the same thing at Blue Shield. We're certainly trying to do that at TruePill with access to care. You can save many dollars and many lives and many years of life. So I think while a lot of us, I think offline tend to disparage technology as being so distracting, in this case, it is really an asset to healthcare to bring healthcare to the masses in a really easy and convenient way.
That age group, though, they're using Facebook, right? My grandmother is on Facebook more than I am. Okay, so there's something, they're there, they're ready. And they're also, speaking for my grandmother, she's looking too for how do I keep fit? That used to be curves out there. I can't find a curves. And so they're looking for that. And I'm going to download that app for her. But they're looking for that extra, right? And so you're right, Tara, it's having that, maybe it's the TV. The TV is already in everyone's homes. It's, already there. We have Fire sticks. It could be that, but it is a device. It is the remote monitoring. It is, connecting with more people, but education is key, because we won't get the device before we have education. They won't believe in it until they learn about it.
I think also without some of the devices and the technologies that we're talking about here, you're just creating more and more friction for people to get care. So before, digital access, before telehealth, if I wanted to see a physician for something that I noticed on my skin, for example, I had to call center, probably have a hold time, try to schedule an appointment, wait for the appointment, have the appointment, get a medication, go to my, local CVS or Walgreens, pick it up, and then maybe have a lab requisition, make an appointment to go do a lab. And so all of these things now, are digitized in some way or can be digitized in some way. And that's actually one thing that my team is really excited to work on now is the at-home lab testing, because you can imagine we kind of solved the mail order pharmacy so that comes conveniently to you. We're trying to solve your physician gave you a requisition to go get a lab test, but you're inconvenienced, you forget about it. But now we're giving people the option, well, actually you can order that and take that test at home and then mail it, and you fulfilled that requisition. So that's super exciting for us. And I think further digitizing or even providing that convenient end-to-end patient experience. And ultimately, again, for care.
Tara, what is your team working on that you're most excited about at Strava?
Well, this is great timing to ask that question, because this week we launched on June 2nd, we launched the biggest app release of the year. One was group challenges, where we allow people the flexibility to create their own challenge with your own circle of friends, up to 24 anywhere in the world. And you can build your own challenge so that you can encourage and motivate others in your circle, in your intimate circle, to get out and be fit in any way they choose, whether it's walking, hiking, yoga, the e-bike, the Peloton. It's up to you, and you get to shape this challenge. The other item that was part of the release is maps. So we had maps kind of all over the place. Now it's very centered, and building better segments so that you can track your personal record, and then you can monitor how you're improving over time with personalized categories. So very, very excited about that launch this week. It's been well received by our Strava community, and just going to enjoy these next few weeks to see additional feedback that we receive about our product launch.
That's awesome. And given that you just joined in February, I mean, being able to really release something that people can get as tangible and within 4 months, that's pretty good. Maybe that's my healthcare bias. I'm like, 4 months, that's blazingly fast.
Congratulations.
Thank you.
Yeah, that's awesome.
Alicia, what about you?
Right now, we're working on, reimagining healthcare. One of the things, if you can go to reimagine healthcare at blueshield.com, you'll see my sidewalk. What I really like about my sidewalk is going back to that education piece. It's showing people what are the barriers in their community, what are the conditions in their community. One thing that I'm really excited about that's coming up, an International Day of the Girl in October, is, reinventing, healthcare is a tech company. We can't no longer be not a tech company. And so part of my role, I work on a diversity and equity and inclusion, serve in that role, is helping our communities as well. And so love being in this seat, because we're going to be doing some STEM related encouragement using what we do here at Blue Shield to reimagine healthcare, whether it be remote monitoring, whether it is the pricing transparency, or the sidewalk I was talking about. So I'm really excited about creating that field trip for them, and showing and showcasing that, the payer too is a tech company, and we need more girls in those STEM related careers, because we need engineers in healthcare, right, Tara?
Exactly.
That's 100% right. And encouraging. I wonder how I'm hearing a lot of optimism on this call, and I'm happy to hear that. There is a lot of pessimism too when you're down in the trenches and going through and being, just grinding. I wonder if anybody would be willing to share a story of, Alicia, I'm going to pick on you a little bit, because you mentioned something which we didn't bring up as a theme yet, but you alluded to it, was this stakeholder management. Stakeholder management on steroids, I believe, is the phrase that you used.
My role.
At a time when you experienced stakeholder wrangling, and it was complicated. If so, why?
Well, the infrastructure is complicated, right? And so data is complicated. Getting things done is complicated, because everyone has their piece of the puzzle, and everyone has their own set of issues that they're working through. So really my role was created and is about, like, how do we bring all these stakeholders across that are impacting these key growth opportunities or these key areas that we need to, I, by nature, am a very passionate person. I like to get things done. And if it's people related, you might want to put me on the job because I'm a problem solver. However, you know, sending me the member complaint will make me for sure make sure that we get that done, right? It's, and whether it's one member or two, it's, you know, we take it very seriously. And so this role really pulls everyone together to make sure, one, we solve that issue right away, but also what's our long-term plan so that never happens again. And I think that's really about where, you know, a lot of these infrastructure problems are being solved, is putting the accountability and putting the right stakeholders and bringing the right people in. And they're solving those big mega healthcare issues around infrastructure because of that.
I'm reminded of a story I heard. I believe I was at Kaiser Permanente when I heard this story, but an anecdote from a tech company actually. And they said, and Tara, maybe you'll appreciate this as a former QA person too. Until you put the engineer into a situation where they're using the exact same computer with the exact same network connection, right? And experiencing the site in the way that they see it through their eyes. It's very eye-opening from a product and engineering perspective, no? To be able to see things from a member's perspective and hear like, I can't believe they're having issues with, you know, sign-on, or for example, why is that? And then you watch people actually do it and you think, oh my goodness, why? That's so hard, right? And thinking about, the difference between the ideal experience and what the product manager thinks it's going to be like, a happy path, and then thinking about why are we getting member complaints about sign-on? Let's dig deeper. Let's see what is happening in their experience and why is that happening. That is very that's very focusing for people, I think, to put them back into the seeing it through the person's eyes who are experiencing the real problem. I guess I will say I want all of our engineers to be able to sit at, you know, one other thing we did at Kaiser Permanente is sit in on into the call center and listen in on the calls that were coming in. And that was fascinating. I don't know, Veronica, you had a chance to do that, but we did that as a shadowing exercise. And oh my goodness, just hearing the things that people come up with, not only, first of all, hats off to people who are in call centers, because especially at a healthcare company, they could get any question. Talk about chat roulette. I mean, they could get any question. It could be, I'm having problems logging in. It could be, I'm having heart palpitations right now. I mean, it could be an emergency, non-emergency. You just do not know. So anyway.
Yeah, absolutely. Actually, that's advice that I give any up and coming product manager, regardless of industry, is to really sit with the frontline people, whether that's a salesperson or a call center person, or in retail, someone who's, you know, helping someone on the floor, or a cashier. You really have an appreciation for the day-to-day, both the user challenges as well as the, you know, the actual employee challenges. Because I think as product managers, especially those who work on the consumer side, we do over-index on the user experience, and sometimes unintentionally deprioritize maybe our fellow colleagues' experience in the call center, for example. And usually, you know, going back to the stakeholder question, they are definitely a stakeholder, along with your clinicians, along with your end users, along with all the, you know, the marketing, the sales, the operations folks. So it's really important to not forget about that, because those frontline people are the ones who actually have the closest interaction with your customers. And that's really the impression that the customer is going to have of the brand and company as a whole with that interaction. So they got to be happy too, in addition to the users.
Veronica, that's, you know, that is great, because what you also get is you get the real language, right? And we have acronyms, we have our business language, but the call center, you know, they are the front line. They have so much knowledge on how we can improve the customer experience, because they have the raw. And I, you know, hats off to them, because you're right, they get all types of calls.
And are we at the point now where the technology tools that we're offering, the digital experience we're offering, is better or worse than a phone call? Should we be solving for the problem of limiting phone calls to the call centers? Or is it the case that there's value in both?
I would say there's value in both, because it's not a one size fits all. Not everybody's comfortable with chat. Chat is great for getting things quick and done, you know, but people still want that white glove service. They still want to call in, especially healthcare is emotional. You know, when I'm stressed, I don't want to deal with chat all the time. Maybe I want to hear a voice on the other side. And so, you know, it has to be a range of opportunity. We don't want to go so far down the road that, you know, we push people to robots. There still has to be a human connection. But for the convenience, we also need that as well. We have to stay up with what you said before, the behavior expectation that the consumer already has by their day-to-day interactions.
So for those of us or those of people in the audience who are looking to, maybe are new to the healthcare space, what advice would you have for them getting started in this industry? And Veronica, I'll start with you.
There is such a wide range of opportunities in products in the healthcare space. And I think some do require specialized subject matter expertise in healthcare in different areas in healthcare, but there's plenty of opportunities out there where teams are just looking for very strong product managers who perhaps have worked in highly regulated industries. So you can imagine, financial services would be a really good comp to that, a lot of transferable skills. And at the end of the day, it goes back to what we mentioned earlier. You have to be very focused on problem solving, even as you feel that the problem may be insurmountable, because these are problems that have gone on for many, many years. But we now have the technology, we now have the thought leadership, we now have enough kind of tech companies focused on this space to, I believe, to solve these problems.
I will add to that, like health tech and product management. If you want to get into that, I would say, follow your passion, right? First of all, you have to really love it. It's not easy. It's hard. There's a lot of barriers. There's a lot of obstacles. There's a lot of laws. There's a lot of regulation, but it's so worth it. You have to have that passion. And there's different areas, right? Like, Veronica mentioned the piece of, the financial business, anything that's heavily regulated will give you a good crossover. But if you're an engineer or if you're in tech, we need all of that. We need all of it, right? You need the Internet of Things. We need to figure out how we're going to pull all this data together so that we can predict better, that we can predict better outcomes, and let the member, the patient, the provider control everything through these devices in a way that's, safe, secure, and has positive outcomes. So I think that there's a role in healthcare for everyone. I think it's the next, big industrial revolution. I feel like that piece is coming. Like it's just a matter of time before you got big tech and payer and provider and all of them trying to really figure it out. It's only a matter of time. So if you're passionate about healthcare, don't hesitate. Figure out a way in, find a mentor, find a company. I went with the company that, aligned with my own personal values, their mission did. That's how I connected. But, maybe it's a Strava, maybe it's where Veronica's at. So you can find, I think there's opportunity for everyone.
Yeah, I totally agree with Veronica, you as well as Alicia. I think there's so much opportunity coming into this space as a product manager. I think if you look in your toolbox and if you're a great negotiator, you could definitely do this. As Veronica mentioned, if you're a strong problem solver, you will have much success in this space. You can come from, I agree with you with Veronica as it relates to finance, because there's a way of organizing data that will definitely help when you're building out capabilities. When you're coming from, like myself, from the media space, one thing that I know was valued is being able to curate content and build personalized experiences so it can help motivate and drive athletes. And even from manufacturing, being able to put pieces together, you can bring a unique point of view. So the door is completely opened. I totally agree with Alicia that, that this field is going to be the next field that is going to have this huge disruption and a lot of opportunity for innovation and new thinking. That means that if you're not in this field, you will definitely have the opportunity to do. And also find, as you mentioned, find a mentor, find someone who's recently connected, and find someone who's a seasoned veteran in the space.
And you could definitely find those people here. I think that's one reason why we started this product and health tech community. So I would encourage everybody to join our Slack community, reach out to folks on LinkedIn who you see who are inspiring to you. I wanted to give a big thank you to Alicia Pina, to Veronica Sa, and to Tara King Hughes for joining us today. Thank you so much for your insights and your expertise. We really appreciate you being here.
Thank you for having me.
Thank you.
Yeah,
It was a pleasure.
Hey everybody, this is Nicole Harris-Roberts. I'm here live with Davina Pallone. She is the Chief Product Officer of Fruit Street Clinic and one of our, I would say, co-founders. Davina, I'll have you unmute your mic. I'm not able to unmute yourself. There you go. Hi.
Hi everybody. Thanks so much for joining us today.
So Davina is here because she is one of the originators of product and health tech. And I thought I would start with a basic question, Davina, which is why product and health tech? Why, after all of the LinkedIn groups we can join and the personal connections we've made over the years in our careers, why are we starting this community for product and health tech professionals?
Yeah, I mean, it's a great question. I think that for me, you can never have enough community and you can never have enough direct conversations. And so I think for all of us who are moving into product management and design and UX research in the healthcare space, it can feel very new. The constraints are very real, as our really fantastic 3 panelists that just wrapped up pointed out. And I think making that adjustment, all the questions that we have, there's some really great conferences out there. There's DTX conference series in particular is one that I really love. That's focused a lot on the business side of things, although they sort of dip into product and design a little bit, but to be able to focus on specifically the constraints and the questions that you encounter as a product manager, it's unique. It's a unique space. And the constraints are real, as I typed into the first panel chat. I mean, that's my first memory of stepping into product in healthcare was holy constraints.
Holy constraints, holy Batman.
Yeah.
Why is this so hard? Yeah.
Yeah, and there's another thing that the previous 3 panelists just pointed out so well is there's so much design debt and technical debt in the healthcare space. And when you have to intersect with these systems, like there's so much potential, right? It's mind-blowing how much potential. But then you get there and you want to deliver something, and then you find out you can't do this, you can't do that, you can't do this other thing. You could do this other thing, but you can't get the partner or the people you're integrating with to change what they're doing. And so managing that from the partnership side, from the HIPAA or compliance side, if you're FDA regulated, if you're working on a medical device, all of that stuff, in addition to the fact that it's a very sensitive population, the end user is a very sensitive population. So a ton of opportunity and then just a ton of constraints.
Tons of opportunity. I mean, we come to this thinking, why can't it work just like Facebook? Or why can't it work just like this tool I use every day? Or, you know, and then you get under the hood and you're like, actually, one of my colleagues, former colleagues, her name is Kim Garrett at Kaiser Permanente. If you're watching, Kim, she used to say things like, I don't want to, I turned over this stone and I found all these worms. I sort of wish I didn't turn over the stone, but then on the same time, you have to turn over these rocks in order to see what's going on.
Yeah, for sure. But I think at the same time, we have to remember that we actually are competing with the Facebooks and the Instagrams and all of the apps that are just fun, TikTok even, that's on our users' mobile devices. And so and especially if you're working on something around behavior change, if you want to change the behavior of the patient or the participant or the member in a better way, this is around something though that's really hard. So if you have an option to pick up your device and log what you're eating for diabetes or self-management, or check out some TikTok, this is the competition is real also, and every user has a very high bar for what they consider to be what an app is because of all these really slick consumer apps. And so you have a lot of really small health startups that want to deliver their care digitally, and they're oftentimes building their product team from scratch, building their design team from scratch. They're not necessarily reinventing the wheel, but it takes a lot of time to put all those little micro interactions in and all of this kind of stuff. And sometimes you have founders or boards that are much more on the healthcare side than they are on the design side, and they're not educated around some of the best practices around what it means to make product. And so there's a lot of education that you have to do internally on your own teams in order to say it's worth it to have a UX researcher, for instance. It's so worth it. It's foundational, but it can often feel like a disposable thing. So you have to educate, educate, educate while you're still managing all of these constraints and all of these moving pieces. So it's challenging. So why do we have a conference like this? Because it's so validating to talk to each other and be like, okay, I'm not crazy. This is really, really hard,
Yes.
but it is mission driven. We're here. I think it was Tara who was just saying, like, if you love healthcare, go for it. Can't remember exactly which panelist said that in the last session, but it's so true.
All the above. I mean, Tara, she joined because she had a personal passion for it. Alicia obviously started out as a frontline caregiver, and then went into tech, and then went back. So, and then Veronica is like, I'm a product master, and I got into healthcare, and I was like, oh my goodness, why is this so hard? So it brings excellence to the next level. But listen, thank you so much for popping in. We're going to chat with you again after the next panel, but this is a discussion that you had with my colleague Chris Hoy, Director of Product, and Jillian Ahrens from Therapeutics, Tim Campolone from Therapeutics, I think I reversed that. Jillian's at Pear and Tim's at Click. Anyway, check it out, you guys. We're about to watch. Let's take a look.
Welcome, everyone. Thanks for joining us at our inaugural Product in Health Tech conference. My name is Chris Hoyd. I'm the Director of Product at Vinyl, which is a product development firm that works with healthcare clients. We do everything from sort of early stage product strategy for innovation teams to comprehensive digital transformations for large healthcare organizations. I'm fortunate to get to host a few leaders in health tech today as we discuss the roles that product design and clinical perspectives play in the development of health tech products. So today I'm joined by Davina Pallone, Jillian Ahrens, and Tim Campolone. Davina is the Chief Product Officer at Fruit Street Clinic. She brings over 20 years of experience as a product leader who empowers teams to find valuable, creative, and engaging solutions to complex problems. For the past 7 years, Davina has focused on the intersection of science and software. Before joining Fruit Street, she built the product team at NeuroTrack to launch a digital platform that combines scientifically validated cognitive assessments with a personalized cognitive health intervention program. Previously, she scaled the product platform at Therapeutics to deliver software that is designed to directly treat disease, tested for safety and efficacy in randomized clinical trials, evaluated by the FDA and prescribed by healthcare providers. Jillian is a principal product designer at Therapeutics. She brings over a decade of experience in creating digital products. And since joining Pear in 2016, she's trained her focus on prescription digital therapeutics. Pear's commercial products include her work in both concept, strategy, and digital design. To date, Jillian's had the privilege to study, research, and design prescription digital therapeutics for substance abuse disorder, opioid use disorder, schizophrenia, insomnia, and severe depression disorder in relapsing remitting multiple sclerosis. Tim is scientific director at Click Therapeutics. Tim joined Click Therapeutics as the scientific director in 2020. In his role, he is the science lead for CT155, a digital therapeutic for schizophrenia being developed in partnership with Boehringer Ingelheim. Tim also manages the research and development team, which focuses on developing and validating novel treatment mechanisms and capabilities to support the Click pipeline and platform. Prior to joining Click, Tim was a clinical director and product manager at Pear Therapeutics. And in this role, Tim was responsible for clinical and later technical development of Pear's digital therapeutic for people with schizophrenia. Tim also holds a PhD in clinical science from UC Berkeley. All right, thanks so much to each of you for joining me today. It's a huge privilege to get to chat with you. And I think with that, we are ready to dive in. So we'll start pretty, concretely. I wanna know what each of your roles is really like right now. So I would love if maybe Davina, if you could kick us off, tell us a little bit about what is a day in the life like of your current role?
Yeah, thanks. Day in the life for me right now is largely around program management and making sure that we are aligning all of our product development efforts with what's important to our business and what's important to our programs. A large part of that then becomes making sure that we are developing products that keep patients and participants engaged and ideally adherent to the program. Because in the business model that we have at Fruit Street, adherence to the program directly relates to the milestones that we can bill on. So it's important commercially, but those same milestones are super important to make sure that the outcomes that the patients or the participants have, that those happen, right? So you want to make sure that in the clinical care that you're delivering digitally, that you can get people to stay adherent to the program. And so you're working with your clinical team, you're working with your designers, your UX researchers, and then you're making sure that you line up the most important work for the developers. And so really kind of looking at all of those pieces and making sure that they're coming together in the right way, identifying dependencies, identifying where there might be blockers, clearing those blockers, and then making sure that everything is feasible from a legal standpoint, from a compliance standpoint, from a clinical standpoint, a technical standpoint, and then making sure that there's a really great user experience that we can deliver given all of those constraints. It's really a lot of conversations with a lot of people to make sure that we can keep everything moving and efficient also.
That sounds like a lot to fit into a day. That's awesome. Tim, what about you from the clinical side? What does an average day look like for you?
Yeah, I mean, right now we're in an exciting period of growth. Even in the 8 months that I've been at Click, it's been a lot of helping to build our internal research and development team and really thinking about what it means to be an R&D team within a startup environment and how we can best bring clinical knowledge and evidence generation to really facilitate the development of new programs, new products, but also support products that are already in the market and thinking about how we can continue to evolve them by discovering new ways to either treat disease or new ways to bring clinical science to inform the way that these products help people in their daily lives. So a lot of my time is spent working closely with my product colleagues at Click and really thinking about how we can best integrate the scientific perspective and process within product development and really make sure that each step we are asking the right questions and where possible, bringing data to bear to unlock new capabilities and really take our products to the next level. So it's a lot of time spent kind of equal parts brainstorming and building process as the team grows and as we really make sure that we are set up for continued support for our entire pipeline. So really fun, but it's certainly a challenge, but a good challenge.
Awesome, thank you for that. And Jillian, from the design side, what about you?
Yeah, lots of challenges and constraints to work within. So that's a large part of the creative process is really understanding those and where can we can align. These constraints come from our partners. These constraints are there because we are this device that is regulated. And, at Pear, we have a Class 2 medical FDA approved device, and this is very significant to us. We have 2 products that are under this classification. And what this means is that there are some really tight constraints where we have to work within to maintain that efficacy and that safety. However, there's a lot of creativity because we are software. We are iterating as a product. This drug is not just a molecule. This is the most amazing thing about digital therapeutics is that this is something that we can learn and iterate in within, again, these certain goalposts, if you will. So we spend all day doing this exact same thing, understanding how to work within these posts with all of these different teams, whether it is our research team, our data science, our marketing, our commercial, very much partnered with our clinical teams to really understand what can drive engagement to these really great clinical MOAs. And part of that has been understanding specifically how we can bring the patient voice and have them really drive this engagement.
You guys are working on such high impact stuff. It's really, really cool to hear and really inspiring. I would love to hear a little more from each of you about maybe some recent work that you're sort of particularly proud of, that you've been able to work with your team to get through those constraints that Jillian just mentioned and ship something that you think is going to make a real difference in the world. And maybe I'll kick it back to Davina, if that's something you want to elaborate on a little bit.
Recently, what we've really been focused on is again the question of increasing that engagement and increasing adherence to a diabetes prevention program. One of the things that is the most motivating is when you can look at the data that you have and you can see the impact that it's making. In our case, being able to look at the people who the participants who are coming through the program and when they start and the types of claims data that they have before they start and where that claims data is after they've been through the program, and looking at the reduction in weight, for instance, looking at the reduction in claims data and being able to, those health outcomes data are very hard to come by, but being that we are delivering healthcare in a digital setting, it's really the bread and butter, and it's a really powerful tool that we have. So we use data everywhere. And so I guess coming back to your question, what's something that I'm most proud of at Fruit Street and at NeuroTrack and even at Pear, setting up a robust data science capability and also UX research. Those two things are game changing when it comes to developing anything in the health tech space. Of course, consumer tech also loves those things, where it gets super interesting. And I think Tim can speak much more to this, but the way that we can use data when developing digital therapeutics, it's not just on daily active users, monthly active users. It gets much more complex than that. We're talking about behavior change. We're talking about understanding if they're adherent, what's their engagement, what's the intersection between adherence and engagement. And when you're at a place like Paratherapeutics, you're talking about understanding those MOAs, like Jillian said, the mechanisms of action that we believe will lead to the positive outcomes that everybody cares about. The patients care about them, the payers care about them, employers care about them. And in that sense, I've always loved digital therapeutics because everybody's interests seem very highly aligned. It's about the health of the patient when it really gets down to it. The health of the patient saves money. It saves time for employers, for the patients themselves. It contributes to more positive mental health when you're not trying to battle disease in addition to everything else we have to do in our lives. And so I'm super proud of the teams that we build and the way that we set them up to function in those types of constraints. Like Jillian points out, the constraints are so numerous, but it allows us to get super creative in solving these problems together as teams, as cross-functional teams. And I think that's the whole point of this panel. It's like,
yep.
Can't deliver, as product people, we can't design and deliver clinical healthcare without our clinical teams. And so bringing these together in order to design and deliver, and I think Jillian will speak more about how you bring the patient's voice into that also, is really rewarding from a product development standpoint.
You covered a lot of interesting stuff there. And I also think you touched on beautifully what is the point of this panel and why this is for me such a privilege to get to bring your three perspectives together to talk through this. One thing before I ask everyone else that same question I want to kind of double click on is you talked about the intersection between or even the tension maybe between sort of engagement and adherence. And Jillian, I know that's something that kind of a balance that you have to walk often. Can you maybe talk us through how you think about that and how you approach that when you're designing digital health products?
Yeah, absolutely. I think about engagement. So you think about when these MOAs are clinically validated, They're done so through a study typically, and some very rigorous clinical studies are conducted. And that brings with it some inherent engagement. Just being a part of a clinical study, you have parameters in which to engage with the study that you're told from the outset. And when you're taking this product into the wild, after a doctor prescribes this to you, and you take that home, and you have this product on your screen, and it's right next to Netflix and Facebook, and all of these other amazing products out there. It's interesting. You almost, this digital therapeutic, this product that is meant to really deliver some serious care for your health, is right beside all of these other products that are very engaging cognitively, and so we're really competing with products that are like this, right next to all of these others. And so how do you intrinsically want to engage a patient in their journey in experiencing and being, again, the driver of their healthcare outcomes, and then really adhere to the clinical MOAs. So you have this engagement to drive the MOAs, the mechanisms of action, and what's the adherence output to the entire clinical therapeutic or digital therapeutic. And so we're really looking to drive engagement so the MOAs actually are being adhered to. And so I think that's something that we really need to unlock. These MOAs have been clinically validated through many studies inside of each of our organizations and outside of them as well. We know that they are effective, but really the key to unlock is that engagement to really change behavioral change design, and really looking at it from that human-centered approach is really the secret sauce. And unlocking that, I mean, and this isn't just applied to, one specific disease necessarily. This is all of chronic disease. So how do you drive engagement to meet the kind of adherence and clinical outcomes that you need? And we've looked at a lot of different and various, and I have a lot of hypotheses on what can really work, and we can get into those a lot later. I can elaborate, but Tim, I would love to hear what you think about this as well.
Yeah, I mean, I think one of the things, I think you mentioned it earlier, Jillian, the notion of constraints, and that's something that I spend a lot of time thinking about, because one of the things that I see is a lot of where we are as a field in digital therapeutics has been really focused on translation of what do we know works well in face-to-face treatment, and how do we translate that, and in many ways try to optimize that for digital delivery. And increasingly, I think one of the things that we're thinking a lot about at Click, and we're getting really excited about, is, ultimately there are constraints that went into the creation of evidence-based treatments, in the sense that they were being modified for and optimized for their delivery in a 50-minute kind of once-a-week session, if you're lucky. In some cases, it's even less frequent with shorter visits. And so you had to really structure your approach to fit within the box that you were given, in this case, the amount of time that a human could give you in the context of your treatment. And one of the interesting questions to ask is both, how do we bring novel clinical science to bear by using digital tools, but how do we also really think about what makes a digital modality unique in the way that we can bring treatment to people in very different ways that, the Aaron Becks of the world, and when CBT was being created, just couldn't have imagined. And if he had a smartphone in his hand as he was thinking about, cognitive therapy for depression, would he have done things differently if he was able to kind of deploy this kind of technology with his early patients? And it's something really interesting, because it starts to open up opportunities for introducing science to really drive behavior change in ways that are uniquely suited for digital delivery and maybe wouldn't work in face-to-face treatment at all. And that's really a space that increasingly is interesting. And I'm really excited about some of the projects that we are starting to tee up and have in flight, because I think ultimately it's going to help us start to establish novel ways of what are underlying mechanisms for diseases, and how can we kind of think about digital solutions to targeting those in ways that aren't accessible kind of in more face-to-face traditional modalities.
That is fascinating. I mean, Tim, I think you're literally talking about sort of opening or kind of questioning some tried and true, right, like clinical canon about how this stuff works. And so I mean, that's super exciting. What like truly exciting time to be in this field. I'm wondering if you can talk maybe a little bit tactically, whether it's through UX research or whatever else. How do you explore that? How do you gain the learning about what ways in which the canon might not be fully accurate? How might we advance the knowledge?
And I want to make sure I'm not slandering the good scientists that have come before me here.
Right.
It's less that it's what exists today is accurate and is sound. It's just what were the limitations then the constraints that those researchers had when they were developing their theories and therapies, and how in a world where increasingly we can access people easier and have an ability to reach them in ways that we previously weren't able to, how does that unlock or provide additional avenues for intervention? And so tactically, what this looks like for us is that, we have a pretty diverse science team in terms of kind of just, background and training that allows us to kind of answer these questions or think about these questions in different ways. But as I mentioned earlier, our R&D team really is a tight collaboration with our product colleagues. So it's also, the marriage between kind of scientific thinking, but product process, and how do we bring to bear different perspectives, be it members of our team, scientific advisors who come to this with a different perspective, the perspective of people with lived experience with the disease, and really try to triangulate where are those areas of overlap where we see an opportunity. And then it's just a question of, your good old scientific method of coming up with what are our hypotheses, what's the right design for a study, and how do we build kind of a lean prototype as a first test of this to try to get some signal and see if we're onto something. And if not, we can always go back to the drawing board, we can iterate, or we can decide to pivot to the next opportunity. But it really is this kind of beautiful cross-functional process that tries as much as possible to look at the same question through as many different angles and lenses as possible, and then kind of seeing where those areas of triangulation are.
Tim, so I'm curious from your perspective, as someone who might think about user engagement or patient engagement differently from how a product leader at a very consumer-facing company might think about it. How do you sort of weigh engagement and think about that and ascribe success to it?
So when I think about engagement, one of the things I think about is what ultimately is the underlying mechanism of the treatment that we're trying to build, and then what are the experiences from more of a kind of therapeutic standpoint that map to that mechanism, and really thinking about how do we get people to engage in those loops or those features that really are kind of most tightly associated with or kind of map best to what that underlying mechanism is. So as much as possible, trying to, at least as I think about things, grounded in what do we know from the clinical scientific perspective about this disease, and try to help, be a good, partner with my product colleagues to think about how we build an experience that really brings that to life in a way that's engaging, as a good user experience, but ultimately is mapped back to what is that underlying mechanism. Right. So ultimately, we can understand how, when we're looking at someone's, engagement over time, we can look at a particular experience or an engagement loop and have, fairly good confidence that the engagement there is going to produce the kind of therapeutic outcome that we want, because we've mapped it so closely to what the underlying kind of mechanism for that disease is.
And so in theory, once the MOA, assuming it's been engaged with in the right way and it's been very effective, in theory, it could be a good thing, right, for engagement to sort of die off, right, because the thing will have worked.
Yeah, not all lack of use is bad. I mean, right. I think a lot about, in our face-to-face treatment modality, termination is often a time for celebration. When someone has gotten what they need out of treatment and they're ready to kind of go back to their lives and bring with them the knowledge that they've gotten and apply it, that's something to celebrate. And I think it's a great point, Chris, that it's not always a bad thing if someone's not using something, and having that context can really help turn what is otherwise, a moment where you might feel disheartened that someone's not using your product. And really, you're missing an opportunity to celebrate something for that individual, because it may be something where they've gained that self-efficacy and they're ready to kind of move on without the support of this treatment.
Awesome. And I think while we're on this topic of sort of being very patient-centered, I know Davina and Jillian have a lot to say about that as well as it relates to their work. So maybe Davina, can you just tell us about how patient-centeredness is a value for you and how that gets sort of imbued into your teams?
There is no digital therapeutic without the patient, right? And so what's really important and where design and UX research, what they can really bring to the table is, is considering how to meet the patient where they are and how to listen to what they need, which I'll tell you right now is, I guarantee, just isn't what your assumptions are if you are not a patient who is not struggling with that disease, right? Like, I mean, and even somebody who is a clinician who treats that disease, unless they have that disease, really needs to be all ears and lose any fixed thinking or any sort of biases they may have about what they think is going to work for somebody. It's a real, because we were always building MVPs and getting it into pilots and then trying something out and learning and iterating, it's a rare opportunity to be able to consider how you can support the patient. First of all, how you can support patients who have different learning styles, who like to take information in different ways. Somebody might like to be very handheld through their treatment, and somebody might want all the information so that they can learn for themselves. And not a lot of young digital therapeutics companies have the budget or time or resources to approach it from all the angles. Like you might find that with the Novartises of the world, or somebody who really has huge budgets and can say, we think we have people with 3 main learning styles, and we're going to give them a short survey up front and figure out what those are, and then deliver them the care depending on how they learn. So we're really trying to ride a line of being able to deliver something to a wide variety of people who, for instance, might be dealing with relapsing, remitting multiple sclerosis, right? Just because you have that diagnosis, it's not the entirety of who you are as a person. You might be somebody who has this disease who really wants to be told what to do, 1, 2, 3. You might be somebody who has this disease who really prefer to read through a lot of the literature yourself and make up your own mind. But that's not something that we have the leisure of doing often at companies where we're trying to get something into a clinical trial. We need to understand how it functions in the clinical trial, and ultimately you want to get it into the market. So speaking to users as much as you possibly can, getting their voices into the product, making sure that you hear about how they think about the disease, how they think about treatment, what they struggle with, what their doubts are, what their worries are. And the more you can build that voice into the product, and Jillian can tell so many stories about how this really works, they feel supported, and they feel oftentimes like this, this digital tool, they know it's not talking to them, but if they feel that it understands them, that there's a voice and tone, or that this isn't just somebody telling you what you should do, but it's somebody who really, it's a tool that sounds like it gets where they're coming from, then you will have the power to keep bringing them back into it, hopefully. And then that engagement that you're developing, hopefully, and with the type of thinking and the thought that Tim and his teams can put into it, it drives you towards that mechanism of action. And then that's the goal, is to get the outcomes at the end. And so I just can't emphasize enough speaking directly to actual patient panels who have that, and even more so than that, and Jillian, I'll hand it over to you, but developing deep relationships with these patients and even co-designing with them.
Yeah, Davina, I couldn't agree with you more. And just to really piggyback off of that thinking, it reminds me of quoting Adam Ghazali. He said, when we create new technology, does it have the power to enhance what makes us humans, or does it degrade us? And really thinking and aligning with that, it's how do you holistically elevate the entire person, inside the therapy and outside? So we've been talking a lot about these MOAs, mechanisms of action. This is the therapy is at the center of our digital therapeutics, and it's for incredible reasons. And, really it's, can you put the person back at the center as well? So they're driving it. So you have these digital therapeutics and PDTs, that are very clinically efficacious with these MOAs. But when designing a PDT, maybe we can also translate around these MOAs, not just that purely digital experience of that therapy, but what about accounting for that entire narrative of the patient, the person around it? And, after establishing relationships with hundreds and hundreds of people over the past, almost 5 years now, I started to realize just that very thing, that if you can really understand the people who live with these chronic diseases inside and out, then that story, those values, and understanding what those struggles are, that's not part of the MOA necessarily, but it's one of the most important aspects with living with a chronic disease to represent. So how do you create this like multimodal experience, very personalized experience that lets people tell their story, tell their narrative, hear and identify from others, maybe some peers, maybe coaches, maybe it's just purely through the content, but feel very understood in this extremely empathetic way. I think this is the most empowering aspects of my job, and what I've brought into our PDTs is building these relationships, hiring our patients as contractors, is creating these panels with them and bringing their voice into the product. They're creating the content, they're telling these stories, their voices, you can hear them in our products, you can see their faces, allowing potentially even our customers to become a part of our patient advocacy program. So it's not just after they're done with the therapeutic, then maybe they can start empowering other peers as well. So I think integrating that into a PDT, wrapping around these MOAs, engaging a person that in that kind of way can really drive towards clinical outcomes, just threading that needle. How do you plug into people's lives in that time and space while they're using the digital therapy, and then how you can truly humanize that experience potentially. And I just don't think technology can do it all on its own. So it's really trying to fit into people's lives in different ways. Everybody manifests these chronic diseases in different ways. They might have the same disease, but they're very, very different the way they manifest in their body physically, the way they emotionally are responding to these diseases. It's very unique. And putting that voice into the product first, so they can first experience that, and then doing that hard work so they can almost, it's deregulating maybe something that maybe they don't want to go into the product because they feel shame or stigma, or they're just highly frustrated and alone, making them understand that you're not alone, that there is somebody there. I think that this is what can move the needle, and understanding how multifaceted that these diseases are. You can't just, I think about it, you can't just say, here's a diet plan and here's the exercises you're going to do. Or here are your triggers, for substance use disorder. Here, let's outline your triggers. Okay, now you know them. It's really having this kind of behavioral support, if you will. And so how do you holistically address these human needs in a digital platform? And I really think if you can holistically crack that code to address this across many chronic diseases, that this is, we're on the cutting edge in designing something, that we can change the way we care for patients by really putting them first. I just think, how do we leverage technology and supporting them through the emotions and understanding where they're at first in the most personalized aspect. It just is a game changer. So tactically, we've brought people through into the product, doing co-design, designing features with them, having them write content, having them read aloud the MOA, maybe some of the therapy lessons, It's just been, we've developed a lexicon for, disease specific types and the way people talk about the disease and think about it. That's very much outside of whether, if you have the disease or not. It's very unique. There's so many idiosyncrasies, and we've really put that learning and that understanding in the very forefront to truly understand the patient's experience, why they fail, and taking that lesson and building it into the program.
That is fascinating and admirable and inspiring. Thank you for sharing that. So you've done all this incredible work to kind of elevate the art and science of building trust and connecting with patients and users. And you alluded earlier to some hypotheses you may have around sort of where this might head and what might be really effective. I'm super, after hearing that, I'm super curious now if you could maybe elaborate a little bit on that.
I hypothesize that with that, having the patient's entire hearts and mind understood and being able to convey exactly, where they're at in that exact moment. So how do you do that digitally? How do you translate that? How do you know exactly what they need in that moment? Is it assessments? Is it biomarkers? Is it self-reports? How do you know? I mean, it's just really hard because you're taking out that therapist, that counselor, that provider, that care team, and you're replacing it with a screen. So you need to rely on, I think, a multifaceted approach to understanding that. Maybe it's all of the above, but you have to have, again, enough pathways to address everything, to address that emotional need, that physical need, that and even that clinical need. You have to have enough understanding, and so that takes information from the patient. And so I think that's what's so exciting about digital therapeutics and prescription digital therapeutics, is that this is a hub of getting all of that information, but you really do need the patient to be there, to want to at least provide that information. I mean, but there are ways in which the provider can then provide some of that information, and that gets fed back into the therapeutic. The provider can see the patient and, let's just say for substance or opioid use disorder and different urine drug screens. Well, those results can get fed back in, and that can be, one of the first experiences that a patient has with understanding their health and what's going on with them. And how do you take that moment and bring in, some really powerful alliance with the therapeutic, and then also with the care team as well. And so it's really interesting. So I hypothesize that it's going to be a hybrid approach, and it's going to needs to be very personalized. And this takes a lot of deep technology to really to really power up this very personalized experience. And then it also takes that very soft skills of being able to create content that has a patient-centered voice, specifically their voice at times, just really paired with that clinical content.
I'm going to run with that and ask Tim, are there other, clearly digital health, digital therapeutics, these are rapidly evolving spaces. Are there other sort of trends or hypotheses that you find just particularly compelling and kind of can't wait to see how they play out over the coming years?
Yeah, I think the one that I am most excited about is, getting out of, I think I kind of alluded to this earlier, but I see a lot of where we are right now is kind of really reliant on what's already existing in the literature and doing that direct translation. And I think what excites me is a world where we don't necessarily, wholesale move away from what we already know works, but we begin to, as a field, contribute science to the overall treatment landscape in a way that allows us to go beyond just cognitive behavioral therapy or other third wave therapies, to really embrace, new ways of delivering treatment. So kind of, for lack of a better way of phrasing it, getting out of the CBT rut where not everything needs to be cognitive behavioral therapy. Instead, we can be asking ourselves and really pushing ourselves to think about, given the opportunity we have within a disease state to leverage technology, what can we do and how can we deliver a therapeutic value to someone in ways that maybe haven't been, explored before And how can we do this in a way that contributes back to the overall, treatment landscape, so that these learnings, what the scientific knowledge can be made available to other people for other folks to uptake them and apply them. So instead of relying heavily on the work that's come before us, we begin to kind of pay our fair share of contributing back to the larger scientific pool, ideas and ways in which these things that we can do and ways to help people can really be brought to bear. So I think that, to me, that's something that I'm particularly excited about, is just how we start to introduce new clinical science, led by digital therapeutics, back into kind of this overall scientific process.
Very interesting. Thank you. I'll extend the question to Davina as well.
Yeah, I want to touch also on, so definitely what you said, it's going to be fascinating to see how that feedback loop changes the science, right? Like the fact that we can deliver care digitally is new, and we need to learn from it, and it's early days still. And so it is a really fascinating time to be involved in this. And then something that you said, Jillian, that really resonates with me, and it's something that I really believe right now is, in very early days of health tech, it was, let's deliver it all in an app. And then, of course, before that, it was like, well, you have to come brick and mortar and see a doctor. But you mentioned care teams, Jillian, and I think that one thing that we're really learning is that an app is an amazing bridge between a provider often and somebody in their personal lives, where like you can go see your doctor, and maybe you see your doctor, if you're dealing with a chronic disease, maybe you're seeing your doctor quite often, but there's all this time in between that maybe back in the day, you'd go in and you'd get some brochures, you'd get some handouts, you could read a book. And in fact, I used to, joke about the fact that, like, sure, you could give somebody a big fat PDF of all of the CBT stuff and say, here's your treatment. Right. And so the creativity comes into like delivering it in a way that's engaging, a way that keeps you involved in your care, that gives you more information, that gives you more leverage, that gives you more support when you can't access your provider. At Fruit Street, we have, in our DPP program, we have coaches that you meet with 26 times over the course of a year, and a community that you develop with other people who are in your class with you, who learn with you over the course of that year. And in speaking to our participants in this program, that community and that support with your coach is so important. But it's equally important that you're able to chat with your coach when you don't have a class, or that you can take photos of the food that you're eating and get feedback on that. And also that you can track your biometrics and see how you're doing. You can just digitally set goals and see how you're achieving them. And so both things matter to the participants, and they particularly like when we involve their family. And so we have family days when your family can also learn with you about how to prepare healthy meals and how to shop for healthy food. And so we hear time and time again that that's really important, because you're not on an island with this. You're dealing with either preventing diabetes or managing diabetes or any of these other chronic diseases that are in your life. And you also have your family, and you also have your friends. Maybe you work a job where you have a highly varying schedule. Maybe you're a police person, and you find yourself having to eat out of convenience stores. So there's like, the person's life can't be ejected from it, as Jillian so eloquently spoke to earlier. So where I see it going is digital being one part of a care continuum, and making it a bridge between your providers and maybe multiple different kinds of providers. You might be speaking to a mental health expert. You might be speaking to your primary care provider. You may be working with a coach. You may be working with a physical therapist, and making sure that we can help this be seamless in people's lives and creating that connectivity. It's so much more than just, it's all in an app, or I don't use an app and I just go and see a doctor, or this is my journey, but my family's not a part of it. And so how we can leverage technology now to really connect the dots. And I think, Jillian, as you said, just sort of uplift, like support that person and make them feel like we're not just giving them one more thing to do. Like, I don't think any of us need one more thing to do. So we have to slot this in and, again, meet people where they are and make sure that it's something that is actually adding value to their lives, not just something that they have to do or that they feel, extrinsically compelled to do, but that we don't build that intrinsic motivation, or we don't give them that lift that makes them feel like they actually, it makes their life better.
Thank you for sharing that. And it's so cool to sort of, hear you guys talk about it and sort of like light up, right? When you talk about some insight that you had that connecting a patient with their family in a certain way, like really moved the needle in a certain way. And like, there's a direct connection between that, and an improved outcome, and your product is making that happen. Like, that's just incredible. So I think the last question I want to, or sort of topic I want to bring up to the group here is, maybe a little more sort of abstract. I want to talk about product strategy for a second. So we've talked about, a few of the ways in which, building products in health tech, sort of is unique, right? We've got regulatory constraints. We've got this sort of tension or intersection between engagement and adherence and efficacy. Even on the growth side, right? We've got like long sales cycles and all that comes up, with that in healthcare. So I'm curious, maybe if I'll start with you, Jillian, if you can talk a little bit about how you think about product strategy at a health tech company.
I think the way that I approach product strategy in a digital health space is really looking at what is the value, again, bringing it back to the customer very first and foremost. What is the value for the patient? What are we creating for them that can really move the needle on this clinical need that we have? I think a lot of times it needs to be approached with not just that clinical need and that market fit, but also that need on how we're going to deliver on the outcomes of the patient. And so, I think one of the core strategies is to deeply, again, understand that patient, deeply understand all of the different new sciences and different, like Tim, you mentioned, I think that's so exciting. Maybe it's not just a few different mechanisms of action, but even new ones. I think that's really how you're going to solve this puzzle. And if you can solve this, then, oh my gosh, it'll be a very, very successful organization. And I think at Pair, we are doing some really innovative things, looking at things very holistically, many, many disease spaces, and looking at things, broadly about behavior change and understanding each disease and understanding how we can change behavior and how we can guide towards that self-efficacy. And I think that approach is really going to, change the landscape of digital therapeutics while really strengthening that core need, again, of that person and that care team and that alliance with everybody around them, inside and out.
Maybe, Davina, as someone who has lived and breathed product and product strategy for several years, how do you think about it?
Yeah, I think it really depends. The product that you're going to build and deliver depends so much on the business model. And those business models can vary widely. I was fortunate enough to cut my teeth on this at Pair, where it's a very ambitious business model. I often think of them as sort of an icebreaker ship for this idea of prescription digital therapeutic, as Jillian mentioned earlier, a PDT. And that business model, where they're making a claim that they can treat disease and be efficacious with outcomes, requires a certain process where the digital therapeutics go into clinical trials. They have to prove that they're efficacious, that the outcomes are there. And then the class 2 medical devices are regulated by the FDA, and that compliance structure that you're in it really impacts the way that you're going to build your product teams, the way that you're going to write code, the way that you have to prove that any changes that you make to something that's already been validated aren't going to invalidate what you make. So it's a huge impact at a company. And then their business model of prescribing the app as a pill, basically, is, it also has a lot of implications about the go-to-market strategy. So at a company like NeuroTrack, where they're largely dealing with wanting to prevent dementia. And so you're talking very often about working with insurers who will be providing insurance policies for people, and they don't want to pay out on those. The nice alignment there is that people also don't want to get dementia. I mean, you don't want your insurance policy to have to pay out on your dementia, right? You just don't ever want to get it to begin with. So the way that, so that's not a claim about treating disease. So it puts it in a totally different space. And so who are your partnerships with? They're not necessarily with big pharma, but they're with, like life insurance companies. At Fruit Street, we're B2B, often selling to employers. And so employers are interested in population health. And so that will dictate a certain approach to product development. And your sales, your go-to-market strategy there is making sure that the employers themselves feel that by providing this benefit to their employees, that they will actually see the benefit in less sick time taken. The costs of preventing diabetes have been made clear, and it's very efficacious for them to get people into these programs early and try to prevent it before you're even into some kind of a maintenance program. So the one commonality I see through all of it, again, is the strategy of building really tight knit cross-functional teams between product, design, and clinical. And by doing so, you're going to massively increase your chance of success. If you don't have a tight connection between your clinical and product teams, you're really missing a massive opportunity to really even leverage some of the really cool stuff that Tim's talking about, right? Like how can we be creative in thinking about delivering these mechanisms of action? How might this change what we can do now that we have the power to deliver this in a digital manner rather than in face-to-face treatment? But if you have, for instance, a waterfall mentality where you say, we have this digital or this clinical modality, and we're going to throw it over a wall to a product team and tell them to build it. I don't think that you're going to be successful because you have to educate across the organization. You have to educate your clinical team about what it means to build a product, that this can be iterative. So for instance, if you're coming from, if you're working with a clinical team that's used to treating something with pills, and they're used to doing things in that manner, then it's just sort of like, here's your pill, it never changes, please take it once a day and you'll get healthier, or whatever. I'm highly simplifying, but this is product development. So we can't iterate as quickly in some instances, depending on the regulatory structure that you might be dealing with or the compliance issues. Sometimes can't iterate as fast as a consumer tech product, but you can absolutely iterate. It's not the same with a molecule. I mean, maybe you can put a candy coating on it if people don't want to take it, but it's not the same sort of thing, right? And so building that relationship between the clinical teams, the UX research teams, the product development teams, the design teams, to really say, here's the problem space. Let's really understand it really, really well. And now let's solve that. And then you do want to work with your marketing teams and the market research and your go-to-market teams to make sure that you know where this is going to land. And sometimes that in and of itself is going to tell you what you have to build into the product, but oftentimes that stuff's not incredibly user-facing. I mean, it might be if it's a matter of understanding how you're going to pay for this. Have you met your deductible? Is there an out-of-pocket maximum if you're doing telehealth or something like that? But the tight knit between clinical, coming all the way back full circle to this panel, clinical design and product have to be best friends and really have a healthy relationship, a lot of respect. And so strategically, if you're building a company, making sure that you build that in from the ground level is going to be one of your recipes for success there.
Having worked with both Davina and Jillian, it's probably not surprising that I land very similar in terms of how I view this. And I think couldn't agree with you more, Davina, there, that I really think, one of the things I find fascinating about digital therapeutics is this space between your product strategy and your clinical strategy is pretty small, in the sense that they are trying to achieve the same thing. And how I viewed my role as a clinician on, or kind of working with a product development team, really is exactly what you were saying, like really looking at myself as a clinical guardrail of how do I not necessarily change the process, but rather try to enhance and provide some understanding of kind of what the contours are, provide education, and just help really unlock the potential of that process, that cross-functional team and that cross-functional process. I mean, there's certainly on the margins other things you can do from a clinical strategy standpoint, just as I'm sure there's on the margins things you can do from a product strategy standpoint. But I think it's one of the things that makes digital therapeutics so fascinating is it is like you live and die by how well your clinical and product teams can work together, align, and really drive outcomes for the people that you're building products for. And it's one of the things that I personally love about working in this space is my collaborations and my time working with people like Jillian and Naveen are some of my happiest times at work. And at Click, it's the same thing of my time spent talking to my product colleagues and really seeing how they process and try to break down a problem that I am also trying to break down, and watch how we come at it from very different perspectives, but we're trying to achieve the same outcome. It's just, it makes it so much better, and we ultimately do better work because of it.
Tim, I was going to say I didn't envy you for following Davina's perfect explanation there, but that was great. Thank you.
I would love to follow up just really quickly, because I love these two people so much, and I am just like so on this bandwagon real quick. It doesn't have to be a part of it, but I mean, it's pretty special. So as a designer and coming from a very, traditional design background in a lot of different agencies, and then making slowly the shift into digital health tech, it wasn't until it was midpoint at my time at Pear where I realized that there's this moment where design and psychology really, really do meet. And it was working with, Tim and other clinical directors where that you really need to understand the discipline of the psychology of what's going on with this specific disease. And we could just talk for hours and just listen. And it was just incredible, because I, as a designer, it's this union of these two disciplines. So I would study and listen and learn all of the intricacies of this, like the psychological, these therapies for all of the diseases. And we would just, that partnership, it couldn't happen without that. So one, I think a designer needs to be a human-centered designer. And intrinsically with that, you are very motivated and curious to unwrap the onion layer of everything this means for this person you are designing a therapeutic for. And then you can really partner together to design these really innovative patterns and these technologies that maybe don't even exist yet, right? Connecting all of these incredible different clinical MOAs and understanding these experiences and how you can piece them together to form new insights for patients. It's one of the most exciting parts about this whole field, I think. It's this shared goal to understand, restore, and essentially try to aid in the healing and wellness of a person. It's just incredible. I think about when I did this with both the product I worked on for schizophrenia. It was a pipeline product at Pear with Tim, and I worked with another clinical director for a product for multiple sclerosis and severe depression disorder, or depression disorder, excuse me, multiple sclerosis and depression disorder. And we just, I learned so much about these two diseases and the specific types of MOAs and how you need to translate them. And it was just this partnership that with that, we could understand how we needed to deliver the user experience and shape it and mold it in a way that then a patient was able to really digest it and learn aspects about themselves and their patterns and their behavioral habits, and really lead to that efficacious outcome. It's just so exciting. And with 006, for the MS product specifically, we connected that what I talked about earlier, that we started the therapeutic. Each time a patient would log in, we would ask them, "Hi, how are you today?" We would call them their name or what they would like to be preferred to be addressed by. And we would just ask how they're doing. And this was a chat bot, and it used a lot of if-then logic. So we had just a huge tree of content for any specific space that a patient was in at that moment. And we just responded with empathy first. And we met them where they were. And we told them, "Yeah, I hear you. I really get that. And all right, let's understand emotionally what's going on here and take it a little bit deeper." And they were able to rate things on a scale. And then we're, hey, let's offer some different choice points for where you're at right now behind the scenes. Again, so the patient could drive what they needed to do. And then depending on what they said that they wanted, maybe it's, a cognitive restructuring activity. And then they would go through that. And maybe they needed to understand, hey, ask them, are any of your physical symptoms relating to your emotional ones? Okay, yeah, they are. Oh, no, they're not. We would respond either way. And then we would really understand what idiosyncratic thought, like what unique thoughts, distorted thinking, as it's said and known. What are you having? What's going on right now? And then they could read all of these different responses from a lot of different patients who also are having similar thoughts or negative thinking patterns. So then they're not even feeling like they're not alone, right? But I'm explaining this situation, this specific use case, because it's not like this delivery of cognitive restructuring is in a book. This is that kind of solutioning and brainstorming happens with a human-centered design approach, understanding design principles and user experience, and with that clinician. And then we can even understand how we can surface up all of the insights, after a week, learning different behavioral patterns, different thoughts. Oh, you're having these symptoms. Generally, you're having pain in your body when, you're doing these things and having these negative thoughts. How about thinking about these thoughts that you identified? So it's really exciting incorporating that teamwork portion, that R&D, into really getting at those innovative solutions. And, I think, Tim, you got equally as excited about understanding how we could utilize AI and free text and chatbots and biomarkers. And it's just so exciting, all the emerging technologies and how we can together, bring those forward. And also, I think, Tim, he got deep into Figma. You were writing out like all of this amazing content in Figma, designing different flows and wireframes. It was just incredible.
I have fond memories of sitting in our WeWork in a phone booth talking to you about jobs to be done. So I think it cuts both ways. Clinicians can learn about design thinking and product thinking, and product folks can learn about good old-fashioned clinical science. I think that's the beauty of the collaboration.
Well said. So just cut to that point and
I think that's the perfect note for us to end on as we come up on time here. So to Davina, Tim, and Jillian, thank you so much. I couldn't, think more of what you guys are doing, and you just being on the front lines of driving some really incredible products. This was a huge privilege for me. Thank you so much again for your time.
Thank you so much, Chris. This has been an honor, and I can't wait to talk more in the future together with you all. Thank you.
Thanks, Chris.
Thank you so much.
Wow. What a great session. Davina, thank you so much for joining us again. I'm joined here with Davina Pallone. In case you missed her earlier, she's the Chief Product Officer at Fruit Street Clinic. And you saw her with a different hairdo on the video. We all have different hairdos. Come on, you're rocking your post-pandemic. You're having that moment to leave the house all, looking glam. But most importantly, you guys made some excellent points in that panel. And I wanted to ask you a follow-up question, if you don't mind. So
yeah, of course.
My first follow-up question is behavior change. Lots of discussion about that. What sort of books or blogs or resources do you recommend? Now, you did say you can't just like buy the book on something like cognitive behavioral therapy or behavior change for that matter, and just become an expert on PAT. But do you have any people you follow or books that you recommend, even the classics?
I think one thing that we've really leveraged a lot at Pear and at NeuroTrack and at Fruit Street is the game thinking framework that Amy Jo Kim has out there. And so that's actually something that Jillian introduced me to. And based off of that introduction, I was able to reach out and work with Amy Jo at at NeuroTrack with some folks from Vinyl. And that was fantastic. And that's there's a lot of great books out there around, habit building, et cetera. But really, a game thinking framework to me is, and I chatted about it a little bit in Slack, is the way in which, like, you think about playing a game. So I'm a huge Legend of Zelda fan. I don't know, some people might.
Yes.
Triforce.
Oh, look at that. That's awesome.
So, that's a choice of mine to hop into this alternate world and sort of play this game and go on quests and all of that kind of thing. But if we can layer in intrinsic motivations that games give you, like there's no reason why I have to solve a quest in Zelda.
Right.
So I'm intrinsically motivated to do that. I'm getting a lot of feedback constantly about every single thing I'm doing in that game. And as I play the game, I'm developing mastery at that. And so I think that any way that we can layer that type of thinking, and that's not to say gamify it by adding badges or little rewards that you get for doing a behavior that the doctor thinks you should do. It has to be meaningful to the player or the patient. And so I would say Amy Jo Kim's game thinking framework is something that I would recommend to especially any small product team that wants to understand how can we quickly figure out a way to make our delivery compelling to the user. It's still hard. I remember at NeuroTrack really struggling to figure out how could we possibly make preventing dementia feel not necessarily fun, but compelling. And what was amazing is, Amy Jo could come in and she could help us brainstorm to find that. Everything that she recommends is based in talking to the end user, talking to the patient, talking to the person who's going to be using it, understanding them and what motivates them. So it's not an exercise to do strictly internally. You have to build some kind of a UX research muscle and flex it outwardly to pull those opinions back into your team.
Absolutely. I also follow Amy Jo Kim's work and had the pleasure of meeting her a couple of years ago in person. She was a guest speaker of ours at another event, but she also she did a whole workshop around identifying your core users and she didn't call them enthusiastic fans. Sorry, Amy Jo Kim, if you see this broadcast later, but identifying your super fans essentially, and then designing for the super fan first, and then sort of going from there, which I thought was a really interesting point. Yeah. This is another thing you mentioned in the panel. You said, it's early days with digital health tech. And I kind of chuckled when I heard that, because here we are, and Slack right now is full of seasoned professionals who've been doing this for decades, really. And you still think it's early days. Can you say a little bit more about that?
Yeah, I think that, I've been doing this for around 7 years or so. And the more I see all of the creativity that different founders and companies have for delivering healthcare, I just think that we haven't really seen it explode completely yet. So it's tempting to think that we're maybe in our heyday, but I just don't believe it. And I mean, imagine what's going to happen when VR becomes normal and what impact that's going to have on healthcare, for instance. So, and I think the previous panel touched on this just briefly, but accessibility is a huge issue. And I don't only mean that from the standpoint of,
I don't know if folks on the channel are getting a little bit of a lag or it's just me, but I think she was about to make a good point about accessibility. Can you when you restart that, Davina? Because I think you were making a really good point about accessibility, which is for everyone, by the way, not just
yeah. Sorry about that. Accessibility, not just from making the fonts bigger or making it audio instead of video, but also accessibility. I think something that got me really excited when I joined Pair was the ability to expand the reach of healthcare. For instance, if you're in a really rural location and you can't go to a brick and mortar place, I mean, you could have a telemedicine call. But we often find that, or we can assume, especially on tech teams, that we all have these little fancy supercomputers in our pocket. Not everyone does, right? So how is that going to limit the access to care if we, how do we develop digital healthcare for people who don't have the latest and greatest gadgets? So I think the fact that we haven't even come close to solving that yet means that we are still in early days of what it means to have digital healthcare.
And we'll leave it there. I wanted to tell the group who are watching live that we have a next session coming up, which is all about case studies in health tech and digging into some of the things that your panel touched on, Davina, as well as the prior panel with Tara King-Hughes and Veronica Suh and Alicia Pina touched on, which is all the constraints with HIPAA and everything else that come into play. And yet, how can you be successful? So that's coming up next with Priya Padmanabhan from Walmart Health. And she actually, I will give a shout out to her because she is live in Slack while driving. So she's not driving. Wait, let me be clear. She's not driving. She's a passenger, but she is in Slack live there at Priya Vijay, I think is her handle. So if you have questions for her, join us in the event chat and let's take a look at Priya's talk. And thank you, Davina, for joining. Hey everybody, this is Nicole Harris-Roberts with Vinyl, and today I am joined by Priya Padmanabhan. She's a senior product manager at Walmart Health, and today she's going to talk about why product solutions fail and share a couple of case studies from her extensive experience in the health tech world. Priya, welcome to the program. Thanks so much for joining us today.
Thank you so much, Nicole, and thank you all for listening in today. I am really excited to be here and wanted to start off by sharing my thoughts around why product solutions fail and some of the challenges and a couple of case studies. And what I did as a product manager to identify and solve a problem. Why do product solutions fail? Customers are unhappy. Customer loyalty is critical to the survival of any business. If your customers suddenly find good reasons to start visiting your competitors, maybe it's because they weren't satisfied with your product in the first place, or the type of service that they received has been very unsatisfactory. They've either told you about the problems they were having, or they just stopped coming because the problems they were never addressed. Start listening to your customers and solve for their needs and expectations. Poor market fit. This usually happens because we focus more on technology solutions than on the problem space itself. Too much money these days are spent on technologies, as we often forget to get customer feedback. We need to start questioning about the key problems that are in the market. and needs solutions, what market segments are much suited for the technology, or sometimes what are you trying to investigate as a technology concept for your product. Any given time, an idea might be genius, but an execution can be crappy. We don't want to be there. Time to market is key. Shorter time to market is well worth your time and money. This always gives you a competitive advantage, chance to react faster when the market changes, and always be ahead of your competitors. I think problem development or product development, is experience driven. With a great technical proficiency team and precise communications and able to collaborate, get insights on the demand, time to market can be a lot faster and much more efficient. Finally, not the least, sales and marketing team efficiency. Why is your product not selling? Is your market research being very inadequate? No matter how great your idea is, you really need to understand whether the product stands a chance to exist. Is it really solving the user problems? Go for a quick prototype. Get a beta version out there and to capture all the loopholes to give you feedback for improvement. If market research is inadequate either way, you fail to capture the right insights of your product, the product is led to fail. Or there is lack of awareness between the customers. Products cannot be sold if the users don't know the value of the product. If the value is not communicated, the features and benefits are not communicated of your product to the targeted audience, how do you expect the product to be bought? Let's say the customers are buying the product, but the sales volume is very low. It could be for the reason that customers do not understand the product or how to use it, or they don't perceive the value you wanted them to perceive. Timing is key. Launching early and launching later has its own downsides. Launching early product, customers don't know your product very well. In the latter case, you're already ahead of a very stiff competition. Now, let's dive into what is a PM role in the health tech. What are some HIPAA challenges that a product could potentially face? Lack of ongoing employee training, failing to revisit business agreements, failing to update notices of privacy practices, restrictions to your disclosures, lack of regular audits. All these can eventually expose your patient data and end up with a breach of data, of your patient data, which is the PHI and PII, which is HIPAA regulated. So we obviously wanted to mitigate by keeping all these in mind. Whenever you launch a product, be sure to consult with your legal partners. All product managers are not legally sound in their areas, but it's good to touch base with them and collaborate with them closely ahead of the game when you're thinking about the product, understand the legal repercussions of those products, and then take a deeper dive into your execution. PM's role in health tech. There are three major areas that I focus for my role in health tech to be successful. One is the users, market, and the technology. When I talk about users, I really need to understand who my users are, what are my users' needs and expectations. If I need to do a focus group to get the user's sentiments ahead of time before I take a deep dive into executing the product, so be it. And then what are the common themes from the user's needs and expectations, because all of your scope cannot go into one launch. So it'll help you to understand the high-level themes to come up with an MVP, and then you can iterate on the product based on its performance. Then comes the market. When you're talking market, we're talking about whether your product is going to cater an enterprise or the direct to customers. Then comes the technology. What solutions, how are you going to solution for these products? That's where your engineering partners and the organization infrastructure, everything comes into play. Let's spend a little bit more time on this. Interoperability is accessing multiple services at one point, which means as emerging technologies transform from health and care, there is a need to explore how to create the right data environment for connected health ecosystem. Data at the end of the day is not just for one system when you're dealing with healthcare. As the focus of healthcare systems moves towards supporting wellness, anytime, anywhere care, and an open platform environment is very much required to connect, share data at scale within the enterprises and the systems. Regulations. Understand all the different regulations of US healthcare. It could be anywhere from Medicare, Medicaid, Health Insurance Portability and Accountability Act, which is the HIPAA, Healthcare Quality Improvement Act, which is HCQIA. Integrations. Identify what integrations your product could use to make it easy on the users. Quality. What are the current processes in place that are identifying that are in place, so you identify areas to improve the quality of your product. So let's quickly dive into a couple of case studies that I promised that I would share. The first one is a patient onboarding. Any product or a feature that you're working on, it's always good to understand the underlying problem that you're trying to solve. Here, David is a patient and Esther is a medical staff. These are my two users I'm solving for. But solving for what? The business problem. The business problem here is mobile app adoption is taking a hit. Fallout rates are high. Poor app store reviews. These are the three areas I'm focusing for my business. So for this use case, David is asked to use a wearable to quit smoking. Then the registered nurse hands over a device to David. Then David is excited. He downloads because he's already enrolled in the program. He thinks that he's enrolled in the program. David is not able to log in because his device that is handed over to him has never been activated. He was asked to register first, which he did not expect when he tried to log in. Now on the other side, the user, medical staff, who's Esther. Esther says patients like David many a day. She hands over multiple devices to many patients a day. Sometimes she forgets to activate, or sometimes she collects all those tasks towards the end of the day or even few days for her to activate those devices. She is very well aware that patients cannot log in without the device being activated or registered. Next task for me as a product is, who are my users specifically, and what are their needs, and what are the problem or the product considerations I'm making to solve their needs. So in this particular use case, the patient, who is David, wants a healthier lifestyle and behavioral change. But the product consideration is like David, there are many users at different age levels. So the UI has to be a lot simpler, very intuitive, and they need to be notified and for them to be motivated. On the other hand, the medical staff, shorter workflow, increasing efficiency of their work, and they provide a great value to their patients and also eventually the physician where they work, for which they need required training, fewer steps for them to understand because they already have their ongoing work, and of course, reduced or no errors. On the other hand, physicians, they all fold into physicians because ultimately the physicians, it's lower cost, very high outcome. It has to be easier for them to use the platform that we provide, and the insights that they provide, the data should be super accurate. And then their product considerations are, it should meet all the regulations and the clinical evidence, and the product should perform seamlessly. With all this kept in mind, as a PM, what I did was to first understand and gather, is this a normal behavior on the app today? Collect the facts. Always it's good to collect the current facts and then come up with a delta so you clearly have a vision towards how you're improving the product or the process. When does the situation occur? Is it more occurring on the app, or is it more occurring after in the clinics? And then assess your constraints. Why is it designed this way? Is there a technical debt to it? What is the rationale? If I need to change this process or the product, what all should I be considering if I were to redesign this? Compare existing versus new design against the user value. That's very key. right? If I'm changing something, what value does it offer to the user? Is it making the experience worse, or is it making the experience seamless for them? So it's fewer clicks, fewer frustration, or fewer friction. Gather requirements. Okay, now I have a design process in place. What do I do with it? Should I change any process, or should I change any product? Or what are the edge case scenario that I need to keep in mind? Once I have all these ironed out, then I have a plan in place that I would socialize with my stakeholders. And I define clear product metrics. What is my objective? What are the key results that I wanted to achieve out of those objectives? What is my plan to measure success? How am I going to collaborate continuously until I launch? Now the solution for this product. Patient gets a text in an email with a pen. Then patient launches the app. Patient agrees to the updated policies, if any. Then patient enters the PIN that they received via the text and email. Two things can happen. You can see that the patients are not registered, or the patient data has been mismatched. Both of it can drive towards a support ticket. The support ticket can already have, it's a process that could already been there, or a support ticket process is not there. So there comes the process that you need to establish. And then within the support ticket, who are they calling? Are they calling the physicians, or are they calling the call center? And then either way, the issue can be addressed automatically, the issue can be addressed manually, or eventually the data is never found, they have to start it all over, right? So for this plan, what are the product improvements, or where are we innovating, and what is the process improvement is what I was able to gather when I was gathering the facts and assessing my constraints. Let's dive into the next case study that I wanted to present here, patient-physician communication. I'm pretty sure most of you all in the audience can resonate to this use case very well. What is the problem that we are facing today? Doctors' offices were not able to triage patients digitally prior to the arrival whenever appropriate. Meaning, patients and physicians end up spending more time talking about the reason for the visit for the patients, whether it's pre-arrival of the patient at the facility or the post-arrival of the patient at the facility. Patients perceive that they're not being heard. They had to repeat their conditions many a times and also fill a paperwork at the facility. Doctors have no reference or context about patients' conditions when they're ready to meet the patients. What are the business goals we're trying to solve here? Increase digital self-service, increase digital satisfaction, and faster time to care to patients. The current user journey for Smith, let's take a persona Smith. Smith is unwell. He calls the doctor's office to make an appointment. He listens to the options and he presses force. And then look, he is connected to a receptionist where the receptionist is asking what's the problem, and he explains his symptoms. Receptionist says that XYZ time is available and Smith's get an appointment at 3 o'clock. Then he arrives at the facility and goes to the receptionist, hands over his ID, fills a form with the insurance information, writes down the reason for visit, gives the form back. He's waiting at the facility. Nurse calls him back. Nurse asks him, what is your reason for visit? Doctor comes. Doctor asks the same question. What is your reason for visit? Smith is then finally examined. Smith has to go through 4 or 5 times, iterating on, or not even iterating, calling out why he is there to meet the doctor. How can we enhance this experience and make it much more seamless for them? For this, Smith is in so much pain, he wants to see a doctor. Then he calls the office for an appointment. He selects the appointment option. Within the message, he understands and learns that there is an online appointment scheduling available for him. But he tends to stay on the call anyway to talk to the doctor or to the nurse to get an appointment. Then the receptionist picks up the phone, the medical staff. She asks about the symptoms from him. She types in and puts everything in the system. It's all uploaded to the cloud. And then she wants Smith that he's going to receive a text message to confirm his appointment. He gets a text. He follows the link. He sees that his symptoms are already in the system for him. All he has to do is update the symptoms if at all things have worsened for him since he spoke to the medical staff. And then the confirmation screen, when he confirms he is given a reminder 2 hours. He was told that he would get a reminder 2 hours prior to his appointment. And then he receives the reminders and get a link to check in. The check-in process is so seamless that he's checked in and also paid for his co-payment, if any. And then he arrives at the facility, and then nurse calls him back, checks his vitals, updates the system. Doctor comes in, sees the notes from the, views the notes from the system for Smith. And then Smith is on his way to get his treatment, and off he goes with his prescriptions and other information already in the system before he gets home post-treatment. So that is a seamless. So Smith is coming here, seeing the doctor is what we see, but the key is how seamless can we take that experience for Smith, the end-to-end, from the time he calls for an appointment to the time that he leaves the facility after seeing the doctor. So after knowing this problem, we quickly drove this to a wireframe, and then we tested in front of our users for an appointment confirmation. And then once the way for him to get notifications, whether a text, call, or email, and then confirm his personal information, updating his symptoms if there has been any update, and then finally a confirmation so he can add that invite to his calendar too. We put this in front of our users to understand whether this process even is going to wow them rather than filling a form at the facility. How redundant are they with it telling their symptoms multiple times at the facility to the nurse, to the receptionist, or to the doctor? How consistent the communication can go across the patient, nurses, and the doctors, how easy it is. And apply the learnings and takeaways from the prototype testing that we were going to do, we did to improve the digital experience. And that concludes my presentation, and I'm open for any Q&A.
Thank you so much, Priya. I have a couple of prepared questions, but I also just want to say up front that couple takeaways from me, in that experience with Smith, he wanted to stay on the phone, right? But he sometimes a digital experience can enhance their journey, but also sometimes people just want to talk to a human. And so giving that option available to people is still important, right? Now more than ever, maybe, because people are kind of wanting to connect even more. My first question for you is, through all of this, what were some of the biggest challenges that you faced? You mentioned some of the all the different stakeholders that were included here. You mentioned data many times. What were some of the other challenges you faced as a product manager here? And what can you tell us a little bit more about how you solve for those?
That's a good question, because there is never a dull moment for a product manager. There are a lot of challenges that we face. Apart from the actual work, like for development meetings, we do a lot of industry and market research, manage our backlogs. We have sprint planning sessions, got to be ready for grooming, the stories, product demos, talking to customers, training the customer service teams, many parallel tasks. The main challenge, one of the biggest challenge I should say that I faced, because my strength has been working on the mobile apps so far for healthcare companies. What I faced is, unlike web, mobile experience should be to the point. And it has to be super precise since it has limitations to the screen sizes. Responsibility to engage with the users within the limited time and attention is key for us. So we'll have to go hand in hand with our UX partners and completely understand their journey. So we are succinctly giving that information on the 5-inch screen, but still keeping them engaged, right? So that's been, so since I have this big task in front of me, I always have to be ruthless on the features and prioritizing them and what content goes in and what onboarding details I'm presenting on the UI. So all of those goes in, and then I make informed decisions based on the data, of course, because without data, without real-time data, I cannot make these informed decisions and update my roadmaps as well. So those have been really challenging, because when you actually present the roadmaps to your stakeholders, there are going to be different opinions coming your way. Why is this way? Why do you have to do this feature? Why are you launching it then? So there are a lot of questions and options that comes through you when you have already brainstormed and put it in your roadmap and you're presenting. Now you'll have to back your presentation with data, which is not just the clicks and views, but also the real time, the why, where the industry research and the market research that I've done will definitely come in handy.
So you talked a little bit about product improvements versus process improvements in that workflow, your journey you were showing earlier. Can you give us an example of a process improvement that ultimately led to a product improvement, or the other way around?
Definitely. It all boils down to the action plan strategy for your organization or a facility if you're dealing with hospitals. Sometimes it's a combination of both. You might be dealing with the organization process improvement, or it's more organization and combination of both hospitals and organization. What I do is organize the action plan for any feature or product that I'm working on. Example for the process improvement that I can think of is with my first use case where a device has been activated and there is a support ticket that is opened, and then how the person gets reconciled for that issue, right? Or the user reconciled with that issue. In my plan strategy, action plan strategy, I normally include the areas I want to focus on for improvement. That will help me to map and tie those back to the product goals that I'm working on. And then what initiatives am I going to implement, and what actions should I be taking to implement that? Who and what will be impacted? Meaning, are the engineering teams impacted? Is there a legal process there? So all these have to be understood upfront before you go deep into execution. Otherwise, these are all surprises and hiccups when you're in execution to handle these. And identifying the possible barriers and how to overcome. So example would be when you have a ticket that you want to solve for, support ticket, do you really have a customer support team, right? If you don't have a customer support team, what happens to those issues that users are complaining about? Who is going to handle that? What is the plan in place? So all those should be all baked into this action plan strategy that I normally have. So you kind of tend to ask those questions around what if, right? It's very important. What if questions are super vital. So you're at least, whether you're solving for the problem or not, at least you're asking the right questions. So your partners are also thinking along those lines to help you with the right execution of the product.
What if, for example, you get lots of people asking for support and you don't have a process for that, right? I've been in that situation, and on the flip side, as a product, maybe it's great to have an easy, contact support button, but what happens when the person contacts, maybe you'll get an avalanche. Are you prepared for that? Those are all relevant questions.
And who are you, and what is your user base? And if you have thousands and millions of users on your app, and if you don't have a proper customer support team to support them with their questions, then your product ratings are definitely going to go down.
Right. Because the supporting process is not there.
Correct.
Yeah, that's a great point. Can you tell us about some of the technologies you were working with in one or both of these case studies, and to what extent, every product person has to deal with the trade-offs, and some of those are constraints with the technology?
I think I see this in three different segments. One is technology readiness for any product. The other one is integrations. The other can be user adoption. When I say technology readiness, it reminds me of a product that I worked at Kaiser a few years back, where we were trying to pilot a product called Wayfinder for a Southern California hospital, because all of the hospitals in Southern California, Kaiser facilities look alike.
Yes.
When patients arrive, they are so lost and they are constantly late to their appointments because every single building is the same, right? So we started to pilot a product called Wayfinder, and that could precisely define and help users check in based on the geo-fenced areas or locations. So it was, we were thinking about it when we were doing the check-in process with QR codes that we introduced a few years back for the appointments that the users have. And then comes the integrations, right? When we are trying to do beacon integrations at the facility, we had a lot of issues with our vendors. We couldn't get the bugs reconciled in a timely fashion with them. We couldn't get onto their roadmaps, or it was a constant push and pull with them. And eventually we were not able to give that seamless experience to the user at all. Then comes the adoption. Okay, now the technology, you're ready, integrations, you're great, and then the user adoption. When you actually do the demos to the users, it will actually show the product managers how they've adopted the product. Example would be, in certain cases, adoption can be high, certain cases, the adoption can be more or less normal, because let me think of an example. Symptom checker. Symptom checker is one of the angles that I can think of immediately, where users want to get immediate response once they are put in their symptoms, but you obviously as a product doesn't want to steer them towards inaccurate data. Right. What is the solution or the technology you're going to use for it? Are you using AI or anything else? So those are the questions that you need to ask your partners, yourself, when you're designing for a product, and which is the right one for your organization. So you are ultimately providing a seamless, great user experience to your users.
Thank you so much, Priya, for your advice and the great tips you offered today. If you were going to leave our audience today with one last tip or learning from your experience, what would that be?
Ultimately, what I want to leave you all with is, it is much better to invest more time in upstream of the process to learn more about the problem, understanding the reasons and facts about the users, then move on to a solution. Always ask the right questions, collaborate closely with your stakeholders, leverage data to help you inform decisions, identify your strategic and tactical risks and trade-offs. Most importantly, listen to your users. I'm more user-centric. There is no right or wrong way of doing product management as long as it helps achieve your product goals. I really appreciate you all listening to me and letting me share my thoughts and my learnings with you all.
And thank you so much for joining us, Priya. It's been a pleasure catching up with you.
Welcome, everyone. Thanks for joining us at our inaugural Product in Healthtech conference. My name is Chris Hoyd. I'm the Director of Product at Vinyl, which is a product development firm that works with a lot of healthcare clients, including doing everything from sort of early stage product strategy for innovation teams to comprehensive digital transformations for large healthcare organizations. I'm fortunate to get to host a few leaders in health tech today as we discuss the roles that products and growth and marketing and commercialization teams play in the development of health tech products. Namely Everett Crossland, Chris Lento, and Lauren Clausen. Everett leads the commercial organization at Applied VR, which is the global leader in pioneering therapeutic virtual reality. Applied VR is advancing its clinical stage VR treatments for chronic pain. As Chief Commercial Officer, Everett leads Applied VR's commercial readiness, marketing, sales, and health economic evidence development for the company's breakthrough medical device portfolio. Chris leads the healthcare partnerships team at Noom. Noom is a digital health organization focused on helping people everywhere become healthier through behavior change. Noom offers psychology-based digital programs that power you to make healthier choices by better understanding yourself, your brain, and the science of choice. Powered by data, technology, and human coaches, Noom has helped millions of people meet their personal health and wellness goals, from weight management to diabetes prevention to stress reduction. As head of the partnership team, Chris is focused on growing Noom's presence across healthcare channels. And Lauren manages partnership marketing and market entry work at Propeller Health, a digital health company dedicated to making life better for every person and community affected by chronic respiratory disease. She partners closely with pharma companies, payers, and health systems to grow Propeller's patient user base around the world. Thank you all so much for joining. It's a huge privilege for me to get to talk with you today. I'm really excited for this conversation. And without further ado, maybe I'll kick it off to Chris. Chris, can you just talk us through what is a day in the life like for you?
Thank you, everybody. So day in the life of my work at Noom is I am responsible for helping Noom to grow outside of the consumer channel through the focus on partnerships with life science companies, pharmaceutical and medical device companies, as well as employers, payers, and health systems. So I am often engaged with the decision makers looking to bring our Noom either healthy weight, healthy mind, or one of our disease condition specific programs into the benefit of either a patient, plan member, or employee. This often involves some customization to our programs. So while working with our product team, we're very much working hand in hand to meet the customer's needs and make sure our product can deliver the value that it's intended to. But very much out on the front lines, working with external stakeholders with a strong connectivity inside to our product organization.
Excellent, thank you. Lauren, what about you?
Sure. Hi, thanks for hosting, Chris. Like the other Chris, I also work very closely on a daily basis with the product organization and with external parties like pharma companies, payers, health systems. I'm on the marketing side, so my target goal is really to grow our user base around the world. So I currently work out of our London hub, and we are expanding Propeller across multiple new markets. So really evaluating the problems that patients and providers have in the chronic respiratory disease space, finding how our product can meet those needs, add value to multiple stakeholders.
Excellent, thank you. And Everett?
I guess a typical day in the life of somebody like myself at Applied VR is that we are mapping out our go-to-market strategy, working with an agency of record to build out marketing, market shaping, sales strategy, both to physicians, payers, organized customers, et cetera. At the same time, constantly liaising with product teams to ensure that what we're hearing from the market is translated and reflected in the product roadmap, and kind of working through that difference in dialects and language around what a customer needs, how that translates into a PRD, et cetera. So it pulled in a lot of different directions because it's a small company, but that's pretty much it.
Awesome, thank you all. So now I want to get into a little bit of the tactical side. It does sound like liaising or collaborating or co-creating with product is a reasonably big part of each of your roles. Can we maybe pick a recent time or two where you've done that, you've done it successfully, it went well, and you can kind of talk us through what that looked like? And maybe I'll stick with the sequence. So I'll go back to Chris. Is there a recent time that you can talk us through on that front?
Yeah, sure. Noom's probably most visible partnership on the pharmaceutical side is with Novo Nordisk. And we are partnered in which patients who receive a prescription of the FDA-approved product called Saxenda have the opportunity to opt into a subsidized program, a customized Noom digital behavioral change program that we call anti-obesity medication. So when combining drug plus software, where product interfaces and where I often have to liaise, I like that word, is making sure that the patient experience and the patient journey is seamless. Once they've received that prescription, how do we get them this digital program? How does it get downloaded on their phone? How do they begin using and stay engaged with that program? That isn't responsibility of the business development team at Noom. That very much falls to our product. And while we don't call them marketing teams, really our growth teams to make that that transition seamless. We've done it now 30,000 times. So we've gotten pretty good at it, but it hasn't been an easy path. Lots of trial and error, lots of experimentation, and lots of user feedback that has gone to making this program relatively seamless. There are always challenges with technology, but that's probably our shining example of working together and proving that this can work on the digital side.
That is incredible. Okay, cool. Lauren, what about you? Maybe on the marketing side, is it a little bit different?
Sure, yeah. So I would say the most successful launches or partnerships that I've worked on have been where myself and a product manager in particular work very closely with one another pre-contracting before those negotiations happen, in close communication with any business development or sales lead, so that we can scope out the requirements for that successful partnership early on. And then this tight team learns to really trust each other from the very beginning. So by the time we get to a launch of any sort, we have all of our ducks in a row. We have the plan set out, and we can work closely to make it a success post-launch. So we build that trust internally and externally. So I love working with product leaders who have a nice external representation of our company as well, are able to communicate their work really succinctly externally as well.
Very cool. And Everett.
Yeah, I think, similar experiences probably on a bit of a smaller scale because we're earlier stage, but what we tend to do is go and put the product in the hands of the potential end user, put the product in the hand of physicians who work with those patients, engage feedback on a small level first, and then work to scale from there. It's iterative, and sequential a lot of times, where we are getting feedback from a couple of different sources and then going back and scaling that feedback to, from 20 to 100 to 500. I think a really interesting example that is relatable for most people is that about a year and a half ago, we scaled into the VA with a wellness product to treat acute pain or to help people cope with pain. And when we first started that process of kind of putting the product in front of people, we immediately got feedback both on the voiceover in the virtual reality experiences that really just wouldn't work for the veteran population. It wasn't authoritative enough. It wouldn't be relatable for them. And we also had imagery of campfires, and it was one of our experiences. And on multiple occasions, we had physicians highlight that as problematic because it can be a trigger event. Campfires can be a trigger event for PTSD. And so, we took that feedback and ultimately came forward with a product that was just a much more bespoke, better fit for that pretty unique population, and it's worked quite well ever since. And we continue to iterate, but it's that type of real world feedback that you just you can't get without going out, speaking to customers, getting in with the people who will actually use your product. You can't do it from just research. You have to get out and actually speak to those people.
That's fascinating, and I think speaks to the level of precision and detail, for one thing, required to make anything effective in health tech, but also the level of, like you use the word bespoke, like you gotta personalize it. It seems like in as many cases as possible. So that's
That's fascinating. I'm curious from a tactical standpoint, is that you and your product lead on the same call as the VA, or what does that look like? How do you make sure that no wires get crossed there?
Yeah, absolutely. So, the first few engagements are going to be the commercial team, whether it's sales or marketing. And then typically we bring in R&D and product. R&D is there just to kind of be part of the process early in the event that the conversation translates into something where we need clinical evidence, that we've adjusted the offering to such an extent that we now need to supplement that with clinical evidence. But yeah, absolutely, we bring product in at, I would say, before we're even 33% along. And it can be quite helpful because there's so much lost in that telephone. Commercial people can only be so attentive to, what ultimately would, can only be so attentive in their mind of what would ultimately be in a PRD. And then product people, often jump right down into the kind of down into the weeds very, very quickly. So you strike a balance just by bringing everybody in early.
That's super interesting. So Chris and Lauren, I'm curious if you guys have a different process. Is it earlier or later than 33% into the process when you guys product?
We've tried to bring in product leaders, at least one product leader, one marketing leader, as early on as possible. I think focusing when we bring those product people on early on to avoid solutioning too quickly, we all try to come at it with whatever the client or potential client partner is asking for. They're trying to communicate a need. They're not asking for a distinct list of deliverables necessarily. So getting product leaders who can kind of read between the lines, understand the underlying need that partner has and that they want to serve for their population, not necessarily taking everything that they have to say and creating those exact features necessarily. So somebody who has have a holistic view of what this program or offering is going to look like.
Yeah. Chris, we're not unsimilar to what Lauren and Everett had shared. I work in tandem with product and other parts of the organization. I think maybe one differentiator of Noom is that we have this really successful consumer business,
right,
which is on one side, and we have product and growth and research supporting that. When you drive towards the more traditional healthcare channels, some of the things that have made us successful and some of the challenges we have on the consumer side do not directly correlate to the healthcare side. So I often ask other members of the team when I bring them in to kind of drop some of the things about consumer and be really open. And the Noom product team is great. They want to solve problems more than anything. And it's hard to solve a problem until you identify what the problem is. So we all need to be patient and let our customers drive the conversation there, rather than assuming what worked on a consumer side is going to work on the patient or healthcare side.
Right.
It's interesting too, if you don't mind me kind of layering on. So there's this, there's always this push and pull where the commercial team's out speaking to customers and getting all this feedback about, and as soon as you talk to a customer, and you have a software product, and Chris Linto can speak to this, everybody ultimately immediately becomes a product developer. It doesn't matter whether you're, a chief medical officer of a major health system or not. You look at the product and go, yeah, so this is great for what you were just presenting, but can it do these 5 other things? And so, that's always makes for innovative and creative conversations, but at the same time, you're there to sell the product that you have, right? And so there's kind of this tension where you need to, as a commercial person, part of your job is to read between that, everybody becomes a product developer in moment one, and what is actually a need, a feature that will drive market share. And I think a lot of times on the product side of the house, that filter just hasn't been as strong from their perspective on the commercial side. So they hear a lot of like, well, so-and-so said that if only the product did these 2 additional things, then, we'd have a great deal. And the product team kind of starts to become, rightfully so, a little bit skeptical of, how much are you filtering? And so I think including product in those meetings, not right at the outset, but in those meetings, once you have filtered down to something that is more of a trend versus just a off the cuff statement, is helpful. And it also on the other side of the equation, the product team is often saying, I'm not going to make a change until I know that there's a business case for this. Well, you can only create a business case if you test something. And so if you're out kind of pre-selling something, the product team hates that, because now you're selling something that you don't have in the product.
Right.
And so I think a good solution is doing some more filtering on the commercial side of the house, and then having, once you've done that, once you're into a meeting where the decision makers are saying, we're there, we recognize that we're buying this product, we want to talk about your roadmap. That's, but they're already there for the product at hand. That's kind of the trigger to bring them in. And typically you can get there, pretty early. So.
Everett, to tap onto that, my job has been made a lot easier in that Noom has this, 2 values. One is ruthless prioritization. So I've been told far more times no than yes, right? And we learn from our millions of consumer users all these great ideas, which we experiment with on a daily basis. So by the time the product reaches me for external healthcare distribution, any sort of suggestion that I get from an end client, I have some information that says, over the 14 years Noom has tried that. We've run this experiment. It did not move the needle at all, so it doesn't live as a feature in the program. But thank you for suggesting that, right? What you're seeing now are the results of some really great experiments that did move the needle, and 99 out of 100 are left on the cutting room floor, never to be seen again.
Yeah, it's kind of the great N of 1 versus you guys have the N of tens of thousands or hundreds of thousands. So.
Yeah, I mean, every company has its advantages. The scale is something that, we're able to move pretty quickly on now.
And I think when you have a product leader who deeply understands the larger commercial strategy and why you're approaching one target customer over another, they can feel like they have more of a stake in that relationship as well, and they want it to succeed. So they can solution with the commercial lead to make it work. So it doesn't necessarily have to be where the commercial lead started, but they can find a middle ground that can work for that partner.
Yeah. Lauren, I could say that's advanced, at least in the Noom world, to the point where I feel really comfortable handing a potential partnership or collaboration over to the product team.
Oh wow!
They really do, outside of the business term part of it, they really do understand the customer needs and the building. So it's gotten a lot easier as we've grown and gained more experience in the traditional healthcare worlds, that our product teams really can drive the development of the program outside of the business development or commercial team.
So you guys just segued to the topic that I really wanted to touch on next, which was kind of the tension, like you said, Everett, of growth and product. And it sounds like, Chris, you kind of resolved the tension. It doesn't sound like there's a ton of tension there right now. Like you've maybe done enough experiments, there's enough data that, and you've maybe because of that, you've got enough confidence in your product team that you can let them out into the world and talk to your clients. But I just want to double click on that. Is there are there any more stories of whether you've sold something that the product team was that was like 2 years down the roadmap, or any examples of that kind of tension and how you resolved it?
Yeah, we kind of have a working agreement that there are never promises made and deals are not signed. Everything goes in draft format. But I think the tension that does exist still is a healthy tension. I think we come at this from years of experience on commercial and product, and it's truly a 1 + 1 = 3 type of formula. Our product and growth teams at Noom know things that I don't even consider when talking to clients, and vice versa. So I think having all of our groups together at the table, it doesn't have to be a unanimous decision, but behind closed doors, working through whether or not this is the right opportunity and whether or not we can deliver the value that we expect to deliver are some of our questions that we ask all the time when partnerships are sitting in front of us.
Yeah, I think, there's also this kind of interesting dynamic where an organization faces whatever challenge or opportunity, and that can be a trend in feature requests out in the field, but it can also just be exogenous factors that present some challenge to the business. And I think it's probably just human nature to think about what are your core competencies when you think about solving for that challenge. And all of these companies are built around a core competency of tech development, product development, software development, et cetera. And yet so often an easier path or an easier solution is not product related. And so, I think as Chris Linto said, a lot of these, a lot of the product team, they just want to solve every problem you put in front of them. And yet a lot of times you can, manually solve something so much faster. It can be external. It can be a system thing that's external to the product. Not every single challenge needs to run through, your smartphone app, right? And that's a mindset change to some extent, because for so long, these companies have only been focused on perfecting UI, UX, backend, et cetera. And now they're being presented with a problem set and potential solutions where that's great, but we can do this in a different way. And it's a challenge of just around mindset, I think. So.
Right. And this is clearly a growth heavy panel. So if you guys need to talk some trash about product, please feel free. We definitely need to change our mindset sometime.
We're just doing that in a very diplomatic way, if you can't pick it up. So.
Yeah, that was great.
Most of that's kept behind closed doors, right? But like I said, the tension is healthy. And do we always get along? No, but I think we make the right decisions the vast majority of the time when we talk about it. We can't be that far out ahead of each other on either side.
Right.
And I think in between the marketing and or growth, as you call it, and the product team, we constantly have a healthy tension there to deciding on what are the interventions that are going to engage our patients and providers on our system. Are those marketing or growth interventions, or are those product interventions? And where do we invest our time? And that gets complicated with new deals coming in constantly and pulling engineer time in different places. So I think it just comes down to communication and trying to, again, build trust and understand that people are coming from a place of good intent and trying to work towards the same goal.
Lauren, I think that from my angle is probably the hardest part of my job, is prioritizing and knowing when to ask. Because the moment I ask for something, somebody at Noom will probably have to stop what they're already doing and move to something different. And if I can't make a strong case that it's worth it for them to take X amount of time away from what they're doing that's driving revenue or being productive, I don't have a very strong case. And I've learned that I need to really be crisp and clear in my asks, the amount of time I'll need, and more importantly, what it's going to lead to if I do get their time.
Yeah, and I think that's been a learning experience for me, is learn to speak the language of product, learn the Google Doc files that they prefer, the formats that they want to hear, and just speak their language, put it in the format that they prefer, meet them halfway. And like you said, just distill the information in a way that they they can process it quickly.
Agreed, and I ask for the same in return. So when
yes, agree.
We're talking to healthcare folks, and you need to listen what the customer's saying and why things are in this order and why they take as long as they do sometimes. It's not Noom's not going to break that trend of things taking a long time to develop, regardless of how fast any of us think we can work internally.
Awesome. Okay, thanks guys. That was great. I want to shift gears slightly now to kind of focus the conversation on what sort of nuance or additional factors or complications that this industry that we're all in, healthcare, what this brings to the jobs that we're doing and how that kind of impacts this sort of growth and product dynamic. So maybe Chris, I'll kick it back to you just because you touched on this a little bit earlier, sort of how healthcare impacts product development and how you're sort of in this interesting place where you've got a large, like you said, consumer business on one side where you can maybe test things a little bit easier, run experiments a little bit easier, and that it sounds like can inform the health tech side. Can you talk a little bit about that?
Yeah, I mean, absolutely. I mean, two things come to mind, and using what's happened here around the world in the last 14 months with COVID is a perfect example. We're seeing a vast increase in need from these healthcare channels for our products and services as a result of COVID. I think everything we're doing on the consumer side has helped expedite our drive into, let's say, the employer channel. We now have employees reaching out to their HR and benefit team saying, I'm hurting both mentally and physically as a result of COVID. I need some help. Have you thought about bringing in X, the following product? So I think the moment that has happened is increased the outreach to Noom. But what we're really selling or promoting is something a little different for employers versus consumers. So product team has been with us every step of the way. In what ways does the product or the service need to be different for an employer group versus how it does with consumer? And unfortunately, the demand is outpacing our response to the demand. So we're moving very deliberately and cautiously to make sure we get it right as we transition.
Interesting problem to have. Cool. Everett, do you have anything to say on this topic?
Yeah, I think there's a difference between wellness, direct to consumer, and I guess regulated healthcare, right? And the impacts on product in particular. And not just having to have a quality management system in place and things like that. I mean, I think those are probably pretty obvious. It's more that you have multiple customers that have or stakeholders / customers, because only generally on the regulated side of the house you only have one ultimate payer, but those different stakeholders all have an opinion and need to have their value points met all by the same product. And that can present a number of challenges in balance, prioritization, and it's often tough to navigate it's tough enough to navigate when you're just focusing on one channel at one time. But in this case, if you're selling something that is, say, physician administered, well, you have to keep the patient happy. You have to have the physician happy, as well as maybe even a health system plus a payer. And all of those endpoints together can be quite complicated. Navigating that is a balance between keeping things simple and clean and still, high design and high usability, while at the same time maybe bolting on a few things that are especially valuable to a payer or especially valuable to somebody who's not the end user, but a key part of your business model.
Right, bolting on a few things is what every product manager wants to hear. That sounds great.
That's exactly right. I mean, that's the resistance where they say, look, like we've made this product. We all agree that it's great. It's patients love it. And now we even did the testing with physicians, and we did the payer research around the value prop. But as we go out into the market, payers are saying, I need to, if you want me to extend this product for every 3 months, standard is I need to see adherence. I mean, that's true in continuous glucose monitoring today. And so that's becoming an increasing norm across our industry. And suddenly that's a product implication that you probably could have seen coming, but maybe you thought you'd be able to get around it. And even if you didn't think you could get around it, you had 18 months of a product roadmap that had already been prioritized 2 years prior.
That is so interesting. And your, obviously Applied VR is an earlier stage company than like a Noom, but your product is effective. It's clinically effective. So I'm curious if there are other. I think you just spoke to some of them, but if there are, you got a thing that works, and so I'm curious what constraints, maybe because of the space that we're in, healthcare, that you find as you're trying to grow the company. Like, what are the main headwinds that you face as you're trying to grow your patient base?
Yeah, I mean, it can be something as simple as, so our product is a virtual reality headset. Everything comes all in. You don't have to hook it up to Wi-Fi. And that has long been something that's made the product very user-friendly. Like, we've done testing and we're easier to use than Gmail, right? And that's a huge win for us, and something that we really, our product team is very proud of, as they should be. At the same time, if we need to pull data off of that headset, well, now you have to hook it up to Wi-Fi, or you have to take the headset when it's shipped back and you're reversing the supply chain, and you pull data off of it manually, which is seems so antiquated relative to where we are today, technologically speaking. And it also creates challenges in your reverse supply chain strategy. If you want to just refurb and send something back out, like having this, like, well, we got to pull data off of it first, is a break in the chain. And so that's something that is starts to have implications on the user experience, but you need to think about priorities around the business.
Right. Super interesting. Thank you. Lauren, I'll kick it over to you.
Sure. Kind of a similar sentiment to what Everett was saying in terms of highly fragmented group of stakeholders across the healthcare system, especially in the US healthcare system. So we have many different stakeholders or partners that we work with: pharma, payers, health systems, pharmacies. So there's all these different channels to reach providers or patients, and figuring out what the value proposition is for each of those partners, how to prioritize those partners, and commit resources accordingly is definitely a challenge. I think particular in healthcare, how is it different than other industries? I think there's no tried and true playbook for how to get digital health solutions, digital therapeutics. I know that the industry is very large, but how to get that commercialized, to market, reimbursed traditionally in our healthcare system it's still such a new field. So I think it requires that experimentation with each of these stakeholders, but we can't move at the same pace as perhaps other industries with that experimentation due to some of the regulatory and privacy restraints. So it's a push and pull. We have to experiment with each of these partners to find the right go-to-market pathways and the right commercialization pathways. But we do have some headwinds on speed for that experimentation.
Right, that's a good way to put it. And I think that that does seem to be a common theme, that there's no clear playbook, right? It's some experimentation across the different channels and different partner types, and you just have to see what works and who's receptive at a given time, and run with that. Okay, cool. Thank you. So switching gears a little bit again, I want to talk about strategy, and in particular, kind of how business strategy and product strategy kind of overlap. And so maybe I'll start with a little bit of broad question. I'll kick it back to you, Chris. How would you say that business strategy and product strategy interact with one another at Noom, and what's your role in that overlap?
Yeah, it's a great question and a timely one. Again, I think you get the feel that Noom has two separate sides of its business. It's consumer business that has been around a very long time, in which the strategy and the course has been plotted. It's really simple. Everybody here in the US sees our TV commercials. We're growing country by country, language by language, and there's a clear path to success on the consumer side. It's been mentioned before about Noom is a wellness product, like Everett said, in its current form. It allows us to move really fast and at scale. And now we're deep in the throes of developing the healthcare strategy and trying to how we can leverage all of the great things we've done on the consumer side and bring them over to the healthcare side, knowing there are so many nuances that are different, right? Everything is different. The product strategy lays over the top there. We have wellness products, and Noom has condition-specific products. Noom thinks about having regulated products as well. In which order should we do this? What's most important with which customers is all part of the emerging and developing strategy that we're all very much a part of here. But product is involved in all of it.
Right. And so that's just an ongoing conversation, and you try to keep everyone as informed as possible, and ultimately that strategy just kind of materializes through those conversations.
Yeah, is the dog wagging the tail, or is the tail wagging the dog? Some other things we think about is, what evidence do we have? How do we collect the evidence? What do our customers need in the form of evidence? So that's as important as anything, of who's using the product, does it work, and what are the outcomes that it's producing?
Interesting. Okay, cool. Lauren, how would you respond to that question?
Yeah, I think early on in digital health companies, I've been at a seed stage company too. I think strategy is really tightly linked to clinical outcomes in the research team. So it's, how do we build up that outcomes base? It has to be built in evidence to grow if it is going to be a regulated healthcare product. And then kind of now where we are at Propeller's stage of growth, we work strategy, commercial, and product team really closely to develop a long-term strategy. And then on the team levels, in terms of how we strategize with particular partners, particular stakeholder segments or customer segments, we have leaders from each head of the organization, so marketing, commercial, product, data, clinical typically, and coming together and contributing to perhaps a list of ideas or where we want to go to meet that top line strategy, mapping those out on a level of effort and impact, and deciding how to prioritize that way. So that's quite more tactical, but so like a strategy team who works very closely with product, and then that gets disseminated through different strategic prioritization processes.
Awesome, thank you. And Everett?
Yeah, Lauren said it best. I think, when you look at where they overlap the most, it's often the nexus is clinical outcomes. And I think that, and Chris touched on this as well. Like, what evidence, what data do you need? And so it probably all, like, that Venn diagram really overlaps around that evidence and outcomes nexus. At Applied VR, our product has 6 months of durability. So what that clinically meaningful durability. So what that means is you use a product for 2 months, you can ship it back, and 6 months after shipping it back, you still are experiencing a clinically meaningful reduction in pain. Well, as soon as we saw that data, those clinical outcomes, we said, well, this is pretty fantastic. How do we go from essentially 7.5 to 8 months of non-pharmacologic pain reduction to 12 months, right? And what can we do product-wise? What can we do business-wise? What can we do, hub and patient services-wise, et cetera, to extend that, and then within that 8-month period, increase that clinically meaningful effect to something that's even more extraordinary. But it's all revolving around those clinical signals or the clinical outcomes and what you're trying to achieve, because it starts there. If you don't have a product that's clinically meaningful and clinically effective, then it's going to be tough to scale.
That's super interesting. Okay, cool. Thank you all. We're coming up on time here, so I want to just ask one more quick question. And this is very broad, zooming way out. So clearly there's a lot happening in digital health and health tech right now. There's tons of funding entering the space, a lot of new founders starting companies, just a lot of innovation generally. So I'm curious for each of you, maybe even outside of the company you're at or what you're working on right now, what trends, whether they're technological or industry trends or whatever, what are you most excited about coming to healthcare in the near to medium term future? And I'll kick it back to you, Everett.
Well, one, now that Chris and I are on here, I want to see how I can get Noom to stop stalking me around the internet. That's I'm really excited about having access to Chris to figure that one out. I think the thing that I'm most excited about in digital health, digital therapeutics, is the promise of this, call it, fourth generation, where you have companies that are moving from, have had a tremendous experience in cognitive behavioral therapy or behavioral therapy, and are using all of that mountain of data and mining that to see what they can create and advance that's truly disease modifying. And some of those innovations are going to come out of companies like Noom and Propeller and others, and I think some are going to come from that leapfrog effect that a company that was started in 2013 is really today laid an amazing groundwork for somebody to accelerate through what has been 7 to 8 years of blood, sweat, and tears. And now that groundwork's laid, I think the speed of digital can really be brought to bear against the challenges in healthcare, and I think it's going to be fantastic. And these are going to be truly like disease modifying products.
That is genuinely exciting. Cool. What about you, Lauren?
I think from a high level view, and I think this comes very natural to all of us on this call and within the digital health industry, but a recognition from outside the industry that the patient experience is important and can start to be a priority. I think maybe with so much investment and interest in the digital health space, that will become more of a focus and more of a talking point. The patient experience matters, and improving that just as you would a customer experience or a direct consumer product is really important. I think personally, things I'm interested in are how to leverage the pharmacist better. I think that's really interesting. We've kind of played around with different ways to engage pharmacies and pharmacists at Propeller, but I think it's a really core member of the healthcare team that's underutilized, especially in the States. And being out in Europe right now and kind of speaking with different people in different countries, I think that's actually a theme across many different countries, that pharmacist resources are underutilized. So that personally interests me.
I guess I'll pick it up at the end. And because of COVID, I'm sitting down in my office more often. So I would love to have an applied VR headset to deal with my back pain. But,
Got it.
aside from that, I'm super excited about all of the digital work that's being done, mostly because it's giving patients access to things that they haven't had prior. And while the landscape might be shifting slightly where the healthcare provider has less of a role, but still a very important role, I like the fact that we can deliver these products directly to patients. And now the patient is owning their own health journey rather than relying on so many other parts of a somewhat broken healthcare system. But they can actually take some ownership, take some charge, and improve things on their own as well. I think that's exciting to create educated and informed people who become patients, unfortunately.
Well, I think that will do it for us today. Thank you all so much. This was fascinating and a huge privilege for me to get to host this talk. Yeah, I really appreciate it. I know you're all busy people, and hopefully we can get together and talk soon.
Thanks, Chris. Real pleasure.
Thanks, Chris.
Yeah,
Thanks, Lauren. Thanks, Everett.
That was awesome. Thank you so much to Everett and Chris and Lauren for preparing that presentation for us. Just wanted to, before we begin with our ice cream social, which is happening at noon today, wanted to let you know how that's going to work. So for those of you who are watching the live stream and register for the program in advance, here's what you do. Go to your email inbox. We sent several reminders yesterday and this morning with save the date information for the Zoom call. So what you'll do is you'll click on that link to the Zoom call. We're not going to post it in the live stream. You got to register if you want that Zoom link. But go ahead and join us at noon. We'll kick off with a product chat with Ian Harris, CEO and president of Vinyl, as well as Louis Armstrong, who is co-founder at Killer Creamery. They'll start the product chat, and then we'll dive right into a fun networking session. So it's a little bit like speed networking. It's actually exactly speed networking. We'll break people up into groups of 3 people, mix it up, and given the chats that are going on right now in Slack, there should be a very lively discussion. So I encourage you to do that. We're going to take a brief break here, and then we'll see you back here in about 10 minutes for the live chat. Now, I will explain this too. We are going to broadcast their live intro through here, as well as in the Zoom. So whether you log in to the Zoom directly at noon, promptly at noon, or you have your browser open and you're viewing the live stream or on your phone, no worries, you'll catch the opening remarks. But if you want to join the networking, you got to get into Zoom. Okay. So if you have any questions, please feel free to post them in the general welcome chat on Slack. There's also a chat for the Ice Cream Social, June 17th. Please post your questions and comments there and continue the conversation in Slack. I'm loving the comments I'm seeing, not only from the guest speakers today, and again, thank you so much to all of them for joining, but also to all of you who are joining our new community. So thank you for being here. Thank you for being active. Thank you for being honest. There's a lot of interesting comments happening in there. From people who obviously they get it. There, comments from folks in engineering, from commercialization, from the product side, UX. There are so many different types of jobs and roles and space for people to occupy here in product and health tech. So thank you all for being here. And if you're watching this broadcast after the show, when it's not live, you can visit our website at productandhealthtech.com. That's the best place to stay in touch with us. Also, follow us on LinkedIn. It's Product and Health Tech on LinkedIn. Follow our company page on LinkedIn, and you'll get updates there as well. So with that, I'm going to take a quick break. We'll be back in about 10 minutes with live with Ian Harris and Louis Armstrong. So stay tuned.
All right, everybody. Thank you so much for being with us here today. We're getting toward the end of Product and Health Tech. And in just a minute, we're going to be able to do something great, which is turn the table, turn the camera onto all of you. So you get the chance to talk to each other and to network and to share ideas and talk about what you've learned. As a way of getting us sort of ready for that Ice Cream Social event, we're really excited to have a quick conversation here with our good friend Lewis, who's going to tell us a little something about product development and innovation in another industry. For everybody who's here, though, in the live stream, who's registered for the event, please check your email, look for a link in there. You can also look for the link posted in the Product and Health Tech Slack, and you can go join that now. Our people are there. Our team is there waiting to welcome you. And actually, this stream will be showing in that Zoom meeting as well. Okay. Well, I'm Ian Harris from Vinyl, and I'm joined here by Louis Armstrong, who's the CEO and founder of Killer Creamery. So Louis, introduce yourself, tell us your story, give us a little bit of your background.
Thank you, Ian. Yeah, I'm Louis Armstrong. Yeah, kind of a funny name. And I am a food scientist by trade, and professionally I've been working in the food business, mostly in dairy products, and quality assurance is my background, along with product development and operations. I've kind of been able to touch a lot of the food industry, and probably the biggest thing I've noticed as I've been out there is lack of innovation, I would say, with a lot of the old food companies. And just if you look across the grocery set, you're starting to see some innovation now. And I think it was always built into me that I knew I wanted to do something for myself and innovate in some category. So why not do something exciting? And that's where I was kind of drawn to ice cream.
Everybody likes ice cream, I think. Obviously
Exactly.
You're in the dessert business. It's something that is happy making, kids love it, older people love it, everybody kind of loves it. But this has been a health tech conference, right? We've been really focused on healthcare, wellness, fitness, those things that are connected to our business. Dessert might not be the first thing that you think about when you think about health tech. But your ice cream is a little bit different. It's a healthier ice cream. Talk to us a little bit about that. How did you approach that? What made you want to be in the healthier dessert business?
Yeah, it's an opportunity for innovation, like I alluded to. So as I was looking at the different categories that I could potentially work in that I had experience with, ice cream seemed to be lacking. And as you go to the set now, you see almost an overwhelming amount of better for you options. And what kind of drove me passionately in this category and kind of drives what we're doing today is that experience of ice cream. So yes, we're a quote unquote healthier product. I don't think we're necessarily saving lives with ice cream by any means, but we're still trying to have fun. And you might as well bring something functional to it, take out the ingredients that we know don't need to be there, i.e. sugar. Everything we do is kind of based off zero sugar. So that's what drew me in, the opportunity to really innovate without sugar and still bring that experience to the consumer. So our goal at the end of the day is just to provide an ice cream to people that gives them that nostalgic experience, that love, that passion that really comes with ice cream. And ice cream eaters are extremely passionate. So as we've grown here, we've found quite the fan base, and we keep innovating with our products and continue to get better is a big part of what we're doing.
That's awesome. So now I know, zero sugar has been the big push for you all. One of the things that we heard in the conference today, people talking about is that, a big part in the health tech space is about driving behavioral change, right? You got to get people to do things differently, maybe get people to do things just a little bit differently. And so, when I was thinking about that, when I think about your ice cream, I think that's a big step in that direction, right? How do you get people to drive that behavior change toward, maybe consuming less sugar, right? Picking a better option, right? Well, part of what you have to do is make sure that it has as much of the sort of look and feel and flavor and everything else that they're used to, right? It can't be a whole, complete, and total, sea change in terms of their core experience, right?
Exactly.
And so I think that when we talked before, that's at the heart of some of your innovations. And I want to talk about some of your features in just a second, but before we get there, as product people, we're constantly thinking about things like, who are our users, right? Who are the decision makers? Who are the buyers, right? What are the constraints for them there? And so I want to ask you some of these questions as related to ice cream. So, as a product, right? Who are your users? Tell me about them.
So as the product and the consumer, we have kind of two different levels. We have this tier of buyer that essentially gets us into grocery stores. And ice cream is a big old establishment. It's frozen distribution. There is kind of one path to scale across the country, and that's grocery stores and the supply chain of distribution there. So we have that buyer level that gets us into stores. Then of course we have our consumers. So the consumers are the people that we're marketing towards. Our branding kind of fits around, and probably a lot of similarities to the tech space. We do a lot of market research to see who's eating these types of products, who's interested in making the change from traditional ice cream and coming into our section. And what we find is it's probably nothing mind-blowing, but it is typically families and head of household females that we're mostly marketing to. And people, as a zero sugar ice cream, there's a segment of people that just want to make a change in their diets and have a little bit less guilt. So it all kind of falls into that. But the main consumer of our products seem to be families. So people just trying to make a better decision and cut out excess sugar from their lives and their kids' lives.
Interesting. But I think there are a lot of parallels there as well. In the health tech space, oftentimes you find that there are these gating, factors, in order to get into the game, right? You have to make partnerships happen. You have to go to the big, behemoth, old companies that are well established in order to get access to your potential users. A lot of times you find the same thing, right? With the person consuming it, in your case, maybe a kid, I give my kid, Killer Creamery ice cream, but they're not the ones who get to make the decision about whether or not it's in our house and it's available to them to buy. Anyways, a lot of parallels there, I think are really interesting. Let's talk about features, right? What was the piece that was missing from other, besides zero sugar and all of that, right? But if you look at the other sort of better for you options, right? When you looked at that, what made you say, I know that there's a killer feature, pardon the pun, or maybe don't pardon it, but what's the killer feature of Killer Creamery's ice cream? And how did you come to the idea that was the thing that was missing?
Yeah, it's really the experience. So anytime somebody's coming into the better for you category, they inherently are already thinking they're giving up something, that they're going to have less of that traditional experience. And that's, frankly, quite true in many circumstances. But we're continuing to kind of drive that narrative. And that's where we thought we could bring our kind of killer perspective into this category, is the experience. So if you actually look at our ice cream compared to especially this better for you set and direct competitors ours, we are actually scoopable out of the freezer, which is
that's a big deal. And I've had your ice cream. You get the other stuff out and you have to say, okay, kids want ice cream. I have to get the ice cream out 15 minutes in advance.
There's literally warnings from a lot of our competitors, like, let this sit out 15 minutes for best texture. So I hated that. It is a barrier for anybody coming from the traditional space to jump into something that's better for them. So that's something I've been passionate about tackling. And that's something we're continuing to improve upon, is that experience level, which is what ice cream is all about. So that's what we're passionate about. That's what we're bringing our killer kind of innovation and their processes into, and the ingredients that we use is the experience, all about the experience. And we think that's how
that's a really interesting part. So flavor obviously matters, right? The texture obviously matters when you're eating it, all this stuff. But the major difference is that scoopability factor, right? The fact that you can have it now, right? It's really about giving them instant access when they want it, which is super interesting. So you alluded to this a little bit, maybe a minute ago, but I wanted to kind of dig into this just a little bit more. Your business, grocery business, food business, right? You got these big legacy companies, giant, the grocery stores, giant, sort of food manufacturers, distributors, whatever else, been in business for a long time. They know their way of doing things. You've come along to try to do something different and sort of unique. How did they meet? How did they meet that when you brought these new ideas and perspectives to them? I mean, did they say, yes, bring it? Or did you find resistance? I mean, how do you figure out how to work within that?
Definitely not open arms. I wouldn't say resistance is maybe the right word, but when you're bringing something new, and I'm sure the parallels are very similar to an industry that technically doesn't need you. So you're having to, tell your story to the buyers, to the people that are producing, to the ingredient suppliers, because at the end of the day, they're running businesses too. So if you can bring them business that's sustainable, can grow over the long term, it's something they'll be interested in. So you got to sell that story a little bit, which health, people taking care of their bodies, cutting out sugar is something that most people seem to wrap their heads around and see the trends coming from all different food aspects. So there's an inherent kind of curiosity there to work with a company like ours. And then you show them, the scale that we're at. It kind of shows them that we're a real player. But the manufacturing side is probably the biggest challenge because, again, all these systems are in place for the old ice cream. So very simple ingredients, gluten full, not gluten free, sugar full, all that type of stuff. So as we come in and try to innovate, you're completely changing processes. And then you got to think to like the people that are actually running the plants and the equipment, everything like that. It's a completely different mindset about what the expectations are for mixing, for producing, and everything like that. So completely down the chain, you have to completely change people's mindsets about the product you're making, that there's new norms and new processes.
So it's not just different ingredients, right? The process is different at its core. You have to go in and negotiate with the manufacturers to have them do things differently, right? Mix it.
So in a way, the recipe and the ingredients are almost the easier part. Like we can make that happen fairly easy, but taking that and scaling it into the processes that are in place, if you don't want to be, selling at your local market and hand scooping yourself, to try to scale across the country, those big plants, the process is what you have to change.
That's interesting. And so when you got into the food science business, you started out saying, I want to be a food scientist, I want to work in this space. When that happened, did you think that you'd be spending the majority of your time, within a short period of time in your career, trying to negotiate with people and, trying to tell stories? And
no.
Did you think that was going to be
No. I thought it would be making cool products. And I don't know, I guess I didn't think much beyond
working
that
in a lab
besides
somewhere.
Product development. In the lab. And that's what a lot of my food science buddies did. But I kind of ventured off in a different course and crazy, I guess, and decided to start my own business. So now I got to do all the fun behind the scenes stuff like storytelling and capital raising and convincing these huge companies to take on innovation, which is difficult.
But worthwhile, I think.
Oh, yeah, very much.
I think the final question I have for you is sort of, we have this idea of a product roadmap, right? So you have your product, you continue to innovate. I guess number one, your core product, which is ice cream in pints, right? Pint ice cream.
Just like this right here.
Yeah. Do you have a roadmap for that, or is that done, or is this something that you continue to innovate on? You continue to make new versions of it?
Yeah, good question. Never done. Like I'm never satisfied. And even this is our 2.5 recipe, I guess you could call it. Where we began is so much different than where we're at today. And this is just like 2 years since we developed this particular product line. So that the texture, the scoopability, the whole experience has changed significantly, and it's continuing to do so as new ingredients, as we discover new processes that we can get more towards traditional ice cream. So we're here and we're not quitting there. We have other iterations and ideas and things that we're trying from a procedure and ingredient standpoint that'll continue to improve that experience until it becomes just, in people's mind, ice cream. And from there, we just launched our ice cream sandwiches. So we're tackling other parts of the category.
Which are delicious. Sorry, I don't want this to sound like
an
infomercial, but you did send me some of those. My kids fought over them. So those are really, really good.
And we just launched them. Yeah, very, very difficult to make. It took me an extra year beyond what I thought it was going to take. And
why was it harder than just slapping
the process? So long story, but pretty much what we just got into, that wafer itself. So one company kind of controls the entire wafer market. So coming in there and trying to innovate and give them a new recipe and process just takes time. And fortunately we got there and we have a great partnership there. And I feel like we have kind of a stranglehold on that side of the business. So novelties are a very cool part. And I think that kind of comes into the health side too, because it's portion control and it's a place that, I really wanted to start the company, but to make an ice cream sandwich is much more difficult than putting it in just a pint and getting it out into market. There's more elements. So we have the ice cream sandwich now, and we're working on our next one, which would be a cone. So think of like a Nestle kind of drumstick, but our killer version. So sugar-free, all natural and everything like that. And we're pretty far down the line on that. And again, innovation, nobody's touching that space in any good kind of sense. So we're moving fast and it's exciting. Absolutely.
I love it. So what's your favorite flavor of your ice cream? I know some of the folks we were able to send out and some of them have received it, some of them haven't yet, but will be. Maybe I think the first 100 or so folks that registered at Product and Healthtech, we mailed them a sampler of your flavors. What's your favorite? Which one do you like the most?
Yeah, it's probably a little bit of recency bias, but we did just launch this chocolate chip cookie dough, which we call Chip Chip Hooray. This is like an obvious flavor, right? chocolate chip cookie dough is a classic, but we haven't launched one until now because we could not get a cookie dough piece that we were satisfied with. So we're finally able to develop one, and that's what triggered us to kind of launch that. So it's a little bit of probably a passion project and recency bias, but I truly think it tastes amazing. It's just one of my all-time favorites. Then from there, the ice cream sandwich, man, that's always been a love of mine, to a detriment in the past, but now I can kind of take that guilt out a little bit. So yeah, loving the products.
I love it. I'm a big fan of the caramel's back. That's the one that did it for me when I was sampling all of your flavors. I told you this before, but I took a spoonful of that and put it in my mouth, and I said to myself, this is ice cream. This is it. Like, wow, I can't believe they nailed it, which was very exciting. Cool. Awesome. Well, for those of the folks that have been watching thus far, if you haven't already, I really encourage you to go and join the Zoom that's posted in both Slack and that you'll see in your email to get started with our social networking, our ice cream social that'll be starting in about 5 minutes here. For everybody else, thank you so much for joining us here at Product and Health Tech. Lewis, thank you so much for joining us and telling us your story, and for making some of your ice cream available to the folks here. And hopefully I'll see you over there in the networking as well. Thanks, everybody.
Thank you.